toes and nails. Oh, that shit'll get you every time. Oh, that shit'll get you every time. Throwing cash all in the air, we don't gotta be nowhere. Watching y'all up in the club, y'all be losing everywhere. Oh, that shit'll get you every time. Oh, that shit'll get you every time. Throwing cash all in the air, you don't gotta be nowhere. Watching y'all up in the club, y'all be losing everywhere. But that shit'll get you every time.
Guess that's what I get for leaning into the best friend. Now I've got one more accent, two less hands here for holding. Ignored all of my reasons for running far from my feelings. Now I'm down on my knees and watching you as you're leaving. I hear you say goodbye, and I say I'm fine. But really if I'm honest with myself, I'm a mess. Total fake, thinking I might need some help. Cause I never change, always getting in my own way. Oh, look at this mess I've made. Look at this mess I've made. Oh, I'll take the blame for making you hate my name. Oh, look at this mess I've made. Look at this mess I've made. Oh, oh, look at this mess I've made. Look at this mess I've made. Oh, thought I learned my lesson that love does not equal tension. Turns out I'm still the same kid, falling hard for affection. And it hurts so bad when it's over, when we both wake up and we're sober. But got that first little moment, feeling you leaning closer. Hear you say goodbye, and I say I'm fine. But really if I'm honest with myself, I'm a mess. Total fake, thinking I might need some help. Cause I never change, always getting in my own way. Oh, look at this mess I've made. Look at this mess I've made. Oh, I'll take the blame for making you hate my name. Oh, look at this mess I've made. Look at this mess I've made. Oh, oh, look at this mess I've made. Look at this mess I've made. Oh.
Why do you hate me? Why do you hate me? We don't want the same thing. How could you blame me when I ain't the same me? I want you to love me back, babe. But that don't mean I love you back, babe. Cause the boys from the gutter dream of girls from the valley, and the grass is always greener when you're living in an alley. Yeah, we smoke, that's just how we cope. Xannies with the coke, just so I can float. I just bought me a chain and it feels just like a shackle. Got a heart full of hurt and some demons I can't tackle. Got my feet on the earth.
Hello. Good morning, everybody. Can you hear me? We'd like to call the meeting to order soon. Give it about 5-10 more minutes. Thank you.
I can't go. But the boys from the gutter, dream of girls from the valley, and the grass is always greener when you're living in the alley. Yeah, we smoke, that's just how we cope. Xannies with the coke, just so I can float. I can't go. I can't go. I can't go. No, I can't go. I can't go. I can't go.
This is for my special one. On a special day. Shade on. My only one. I've been waiting for this moment and now it's here. Now it's here, yeah. Mine, oh mine. I've been waiting to take you home and now we're here. And my promise to you, baby. My love for you, baby. Oh yeah. My love for you. Yeah, yeah. Now go with this, yeah. My love for you. My love for you. Yeah, yeah. I'll never leave you, babe. I will never. I will never leave you, baby. I will never. I love you. You're the one I want for me. No matter the economy. I could die for you, baby. I could be with you, I could fight for you. Anytime, any day, anywhere. I choose you for life, no doubt. My love for you. My love for you. No competition. Oh, baby. My love for you. Go be no competition. Oh, no competition. My love for you. My love for you. Yeah, yeah. I'll never leave you, babe. I will never. I will never leave you, baby. I will never. Baby, now I can wait. We start at home, me and you. And our babies don't look like us. It's such a beauty to fall in love. What a beauty to find you, babe. And I promise my love for you, baby. Oh yeah, my love for you. Yeah, yeah. Now go with this, yeah. My love for you. My love for you. Yeah, yeah. I'll never leave you, babe. I will never. I will never leave you, baby. I will never. I love you.
처음 본 순간부터 눈을 뗄 수가 없었어. 이 세상 하나뿐인 너 처음 봤으니까 빠졌으니까 Then you got me sinking low. 사랑이란 단어로 섬도 아닌 섬을 타며 행복한 줄로 친구들이 다들 바보래. 사랑 표현 못한 벙어리 한 번도 안 해봐서 어떡해 honestly. Cause 1, 2, 3 중요한 건 you and me. 내 곁에만이 진심인지도 Guess like I've never guessed before 날 좋아하는 건 맞아 친구들이 다들 바보래 사랑 표현 못한 덩어리 한 번도 안 해봐서 어떡해 Honestly Cause 1, 2, 3 중요한 건 you and me 내 곁에만 있다면 Baby can't you see 자꾸 쳐다보면 뭘 말이라도 걸어봐 속마음을 표현해 I know we're gonna be alright 손이라도 잡을까 품에 안겨볼까 Whatever your love language I know we're gonna be alright I know we're gonna be alright
Yeah, China. Late night, break it down. Late night, yeah. If I ever miss this chance, please take every word that I say today. I'm very sober when I say this. May I believe that I found the one. The way she moving away, she done make me lose control. Come willing, I go shake it, break it. She got you mad over the pain. She my late night, give me a shot. She just give me everything. She my late night, she my medicine. She my medicine. She my late night, yeah. She just give me a shot. This out in low. She my late night, type of love. She my late night, my painkiller, God she beat to me. My body healer, God she beat to me. When I see her body goes, I forget money. The way she done for me, me I lose my mind. She my late night, give me a shot. She just give me everything. She my late night, she my medicine. She my medicine. She my late night, yeah. She just give me a shot. This out in low. She my late night, type of love. She my late night, medicine. She the one I can't live without. When I am tense, she my breathe out. And all I'm dreaming of is
Hello. Good morning. Can you hear me? Hello? Oh. Good morning. Welcome to our annual general meeting. I'd like to call the meeting to order. It is, sorry, well, I'm gonna flip your phone. Oh. What time is it? I didn't bring my phone. What? 9:24. We're calling the meeting to order. We'll start with the opening ceremonies. I'd like to ask Victor Lyons Drum to have our opening song.
Bonjour. Bonjour, Nandinri Maganak. My English na kind of go to them. I just not take the gig. I just wanted to say that I come from Pelican Falls this morning, Pelican Falls First Nations High School, and this is the grandfather drum that comes from there. And I brought three youth with us, and I was just thinking about, like a long time ago, when it was in a residential school, one of their goals was to remove the Indian from the child. And today, we come here to try to put that traditional teachings back in the child. So that's the reason why I brought these students along with us, to try to reinforce that in these type of practices. The song we're going to sing this morning, once Charles passed me that tobacco last week, this song came to me. And we call it, it's sometimes referred to as a whirlwind song, but in this instance I'm using it being known as the bird song. And the bird song, the dream for this song was envisioned, and it was a whole bunch of birds that were flying in the sky in the same direction. That was the vision of what this song was. And I look around at the different chiefs and the different representatives that are here. And if you know anything about the bird clan, Migizehoe is the boss of the bird clan, and some of the roles and responsibilities are to be provide vision for the nation or vision for the community. And I think that's why this song came to me, because that's what you're here to do, to try to provide vision and work together, planting those seeds of knowledge also, not only to these youth, but to the future generations. And that's what we're going to be thinking about as we sing this song.
Good. Thank you, Victor Lyon, and thank you for sharing. We'll now go to our SLFNHA elder, Thomas Spade, for the opening prayer. Thomas?
Seguendo il tempo che siamo tutti che mi lo sai che come tutti che lo sai non hanno da che cosa bata non to che tenen ma non mata che la che den Jesus Christ non ha come cosa che va che che un diretto me shan e ma che non da che go che mi lo sai che das che con che non ma go Buksal manang gagi ko tan sababe ko ma bin tike shan mishan min ke kitma ginen tike kitma mishan ko mi na ko gon no bola leva ke ri ko mega ke ko tingo ma se mi ke ma to ta ke ko tinge mi sta res buksal man ke das ke to ma go to no de to ta ke ko na buksal de man gagi mi ga se zit ke an to ma go ge ya jo to Jesus Christ. Amen. Amen.
Miigwech, Thomas. So we'll continue with the meeting. I don't think we have quorum yet, but we'll proceed. We just won't be able to make any decisions until we have quorum. So I'd like to... Okay. So we're going to do the procedural resolutions, adoption of the chair and the co-chair. So for our annual general meeting, resolution number 25XX, there's no number on here. Okay, be it resolved that the chief in assembly adopt Wally McKay and Brenda Fox as co-chairpersons for the Sulakaut First Nation Health Authority annual general meeting held in Lac Seul First Nation, Ontario, September 10 and 11, 2025. I need a mover and a... No, I guess we don't do that part, right? Because there's no quorum? Oh, okay. So, and a seconder? Okay. We'll have a mover and a seconder, but no vote until we have quorum. So can I have a mover, please? Thank you, Chief Wesley. And seconded by proxy Alan Tate. Miigwech. Thank you, Wally.
Thank you very much. Due to the lack of quorum, we can't make any decisions, but we can have a discussion. And what we'll do is that we'll go over the agenda and present that and have any discussion, and we will not be able to vote on the adopting of the agenda until we get the quorum. I believe we have 13 right now, and we need 4 more. 17 is the quorum for SLFNHA General Assembly, okay? So I'm just going to go through the agendas. Yes, Archie. Do we have chiefs online? Do we have any chiefs online? No, we don't. So the agenda is in your tab 1. If you would go over the agenda with me. The board chair, Cynthia, will come up for the adoption of the chairs. It has been moved and seconded, and she will call for a vote on it. And we're going to go through the agenda now for a discussion so that when we get a full quorum, then we just move into the decision making. At 9:30, board chair's message, Cynthia Fiddler will be presenting that, and also the Chief's Council on Health report, Chief Donnie Morris and Chief Clifford Bull will be, who are the co-chairs for the Chiefs Committee on Health. At 10, we're going to have the executive management reports. Sonia Isaac Mann, President and Chief Executive Officer. Janet will be providing the community health. Monica Hemanen, for regional services, unfortunately is not here with us. I have been informed that she lost her mother just recently. So we extend our condolences to her family, and also Brian Kalhia, Finance and Corporate Services, will be making the management reports. We may have to forego the health break, but just if you need to help yourself to those things, please feel free to do so. 11:30, we'll have the SLFNHA audit, and then we go into the lunch. At 1 o'clock, we're going to have the annual general resolutions, acceptance of 24-25 audit report, selection of 25-26 auditor for SLFNHA, acceptance of 24-25 annual report. Around 1:30, SLFNHA business items, 22-27 strategic plan evaluation, and the engagement pathway, mental health and addictions. We'll have a health break, and then we'll go into a SLFNHA Tikanagan Partnership MOU signing. At 3 o'clock, we'll have the Chiefs Forum. 4:15, we'll go into the closing remarks. We'll adjourn the meeting, closing prayer by the SLFNHA elder, closing song by Victor Lion Drum. And at 4:30 and 5:30, the Board of Directors of SLFNHA meet and greet. On day 2, we'll have registration at 8 o'clock in the morning, and there'll be breakfast. At 9 a.m., call to order. A GM meeting co-chairs, myself and Brenda Fox. Opening song by Victor Lion Drum. Opening prayer by Elder Hammond Laxul. We'll have a 9:10 recap of the day 1 meeting. 9:15 presentation of Laxul First Nation Healing Spirits Wellness Center. Donna Kiesik, you'll be doing that on virtual. And 9:30, SLFNHA Partners, and that's Anishinaabe Eskimo Nation. Deputy Grand Chief Anna Betty will be doing that. And Sulakad Minyawan Health Center President and CEO Dean Osman, and Sulakad Regional Physician Services Board Chair Dr. Butte. And then 10:15, we'll have a break. 10:30, SLFNHA Partners continued. Northern Ontario School of Medicine, Dr. Michael Green will be presenting through a virtual. 11 o'clock, we'll have speakers on proposed resolutions. Just before you have a break, we're going to have a short message from Dr. Terry Farrell. And then we'll go into 12 at lunch. 1 p.m. we'll deal with the resolutions. 2 p.m. SLFNHA AGM 2026 SLFNHA AGM date. 2:15 presentation of gifts. Closing remarks, board chair. Unfortunately, the chair, Cynthia Fiddler, will not be able to be here with us, but Secretary Treasurer Tanya Bottle will be making the closing remarks. And then we go into the adjournment. the elder will say a prayer, and we'll have a closing song by Victor Lyon Drummagate. So that's the agenda that is being presented. If there is any additions or amendments to the agenda that chiefs and proxies would like, we will not make a decision on it, but we will note that, and once we get the board, full quorum, I will inform the people that come in what the agenda looks like. Discussion. Anyone? I gather silence is pretty well. We have an agreement on the agenda that's been presented. Well, you have a lot of time to think about it, and then we can, once we have the quorum, we can just move into the decision making. I believe that full board membership has to be here before we hear from the executive management reports. It's been a long time since I've been involved with chiefs in the health dialogue. And I recall back a long time ago, and when I say Westcuts, that means a long time ago from my point of view. The was yunaban, ikanobagyan, ikanukyan, api eunaswanok, in the community. Api das uniganich tamagi, ikanota gewi maochad and sinwan. Napit some steak in Dagon. Ego Kakinabago, Ameoya guys, Wakawits, a Kigawayjats, where the Ega weapon sits. And I recall when I was just a little kid before I went to a residential school that times were called upon by the leaders that they want to have a community meeting. And when that call went out, no matter what the people were doing, they would put that, whatever they were doing, put it aside and make an effort to be there at the times because they didn't want to miss anything. Just to let you know, I was just informed, this is on live stream. It's on Wawa T and also on YouTube, so be careful what you say, okay? And I was thinking about the time when everybody made an effort. And in Sanchigo, we had what was referred to as Unasogomik, and that was the gathering place of making decisions. And this Unasogomik was literally translated means the place of judgment or the place of deciding. And that was a house that they built specially. And they made benches for make sure everybody had a place to sit, and everybody would make an effort, and even if you were late, you were frowned upon by the leadership and also by the community, and it had that in-house type of thinking and influence that you cannot be late when the leaders call for a meeting, and I share that story with you because we're waiting for a full quorum and we can't do nothing. And what went wrong? Okay? And that is we are following the colonial institutions of how they do business and how we have a corporate bylaws that the executive has to adhere to. That's what the board, the chiefs have said to do it. And so we have to wait. the transformation that happened from the way we used to do things to the way we do things now, it was more efficient doing it what my fathers and forefathers did in making decisions. And it kept the communities together, and there was a more unity. And so we just need to bear with each other as we wait for people to come to arrive to make a quorum at this particular time. I think one of the things we need to do is to begin looking back into the traditions of our people and how they did things and what worked. And what if we adopt those things, what worked, then there is nothing to stop you from incorporating it into how you go into decision making in a forum like this. And one of the things that, as a colonial mindset that has been embedded in us, is that we're afraid to do it. We don't want to do it. As people to exercise their traditional pathways, we can do things. We can do things, and so that's what I wanted to share, that little story about, how our people made decisions and how it was a sort of honored process. And if you showed up late, if your family showed up late, you were frowned upon. And so it's something to think about as we move. We need to make a transition, from what we are called by corporate requirements to things that work, how we do things. And I think there would be, for instance, like now, you could have adopted us a chair people, and when full group came in, then just ask them if they concur. We need to be imaginative. We need to use imagination how we move forward. So anyway, I just wanted to share that story. Waiting for the full. Are we still on 13, or are we? I think we're still on 13. So we wait for another 4 before we can do any business. Any other? Does anybody have comments or?
Getting the hang of it? Are you getting the hang of it?
Yeah.
Most of it is touch it.
During my message, I'm going to welcome you guys to the board, but I'm going to ask you guys to stand up.
What we can do is
People just stand up and go.
there will be no decisions on that. That's just information on it. So I'll call upon Cynthia Fiddler to present her a message.
Hi. Bonjour, Wachen Doe Magnak, Nanakama Mando and Nungum Gagijgak. It's always good to be grateful for every day you are given, for the new breath of life you awoke with. So I would like to again thank the drum for the opening song, and thank Elder Thomas Spade for his opening prayer. My name is Cynthia Fiddler. I'm from Sandy Lake First Nation, and I am humbled by serving as your board chair. Sulcoat First Nation Health Authority is such a unique and beautiful area that we have. We all have our own vibrant culture and values. So the SLFNHA board is made up of representatives who are appointed by tribal councils and independent communities within Sulcoat area. The board sets policies and procedures and ensure they are implemented and followed. The strategic plan is developed and approved by the board, and it sets the overall vision for the organization. The president and CEO is accountable to the board for implementing the strategic plan. So on behalf of the board of directors, I'm excited to share some new developments with you. We have 2 new board members, Wanda Adlukan Sugarhead from Yabmaktoon, appointed by Matawa First Nation Council. And we also have Rhonda Angies, Wennaman First Nation, appointed by Shabugama First Nation Council. So please, Wanda and Rhoda, give it a little wave and give them a warm welcome to our board. Miigwech. So in the summer of 2024, the board, because we're still learning and we're still trying to come together, we asked for an orientation package, and we're doing finalizations on what am I am lost my place. We're doing finalization on our orientation package, and it'll enhance and strengthen our onboarding and recruitment. So the board continues to build capacity and engage in board governance. That training is facilitated from a First Nations lens and offered in a focused learning on policy development. Although 2028 is a few years away, some of us are already thinking of the next strategic plan and continuing with that First Nation worldview throughout our policies and organization for SLFNHA. I would also like to mention that the Board of Directors summary template has been provided and shared with the board members with the intent to improve communications with the respective tribal councils and communities. For the chiefs and the proxies, you will also be given our contact numbers on a fly sheet for if you need to reach out to any of the board members. That's one way the board has decided to try and be available to you for more clear communication. Also in fall of 2024, the board participated in a joint meeting with the boards from Sulcoat Minuyawan Health Center and also with the Sulcoat Regional Physician Services. Holding this trilateral governance meeting of our major regional health organization has been a long-time goal. I'm so glad the 3 of us got together to talk about the people in the region. And I'm happy, and I look forward to their presentations tomorrow. Lastly, I would like to acknowledge the hard work and dedication of all the employees and current and past board members over the 35 years. 35 years of SLFNHA is a big achievement for the health in our area. It's a good milestone. That was it. Yes.
Thank you, Cynthia. I will now call upon the Chief's Counsel on Health Report, Chief Donnie Morris and Chief Clifford Bull.
Watier, bonjour. Good morning. I want to thank and acknowledge the Creator this morning for allowing us to be here on such a beautiful day. I want to thank the drummers for opening our event, the song they rendered, and also appreciate the youth that have come here today to join us. Very inspiring. And our elder, Tom, miigwech kitinin, nagipake naman. I've also got some information I want to share with members here. Delegates, LACSUL is going through a period of mourning at this moment. Tomorrow, we're going to be burying a young girl, a young lady that passed last week. That's Thursday morning at 11. And we had another elder pass just the other day at Miniawan Health Center. So bear with me as I may not be here tomorrow. I may be in and out, being visible in the community, trying to support the community, but I'll be around. I will be here. So keep us in your prayers as we struggle through our grief. And I also want to acknowledge our good friend and neighbor, Doug Lawrence, the mayor, who's recuperating in hospital. I'm not sure if he's in the hospital, but I hear he's recuperating after surgery. So I want to wish him well and speedy recovery. I also want to acknowledge some of the people that are here with us today. I want to acknowledge Deputy Grand Chief Amnan and Betty Chipaniskam is here with us today. Miigwech for coming. All the people that are here today, staff, senior staff, elders, youth, chiefs, Wally, and our co-chairs here, Brenda, Miigwech Pijayak. We would like to share some information about the role of the CCOH, Chiefs Council on Health. We received the original mandate back in 1996, and the work has evolved over the years. The members represent and are appointed by tribal councils, independent communities, and local Treaty 3 communities. We are here to provide ongoing political direction, advocacy, and oversight in achieving First Nations self-determination over the regional healthcare system as mandated by the Sulakaut area chiefs. In June 2024, at Migizi-Zaigan, Eagle Lake First Nation, and CCOH hosted a special Chiefs and Elders meeting. Chiefs, elders, and health system partners shared updates on existing issues and new strategies in the region. The CCOH has also explored regional health governance and collective ways to improve health services to First Nations members. This included meeting and discussing solutions with the Sulakot Miniyawan Health Center. We have heard many concerns with care and have initiated discussions to seek solutions on how to work better together. The willingness to create a united voice exists, and we will continue to build the relationship with Miniyawan. Donnie is going to take over from here. We're a two-part song and dance team. Donnie's going to dance now.
Machinaden, adogai biaka antikina gebich machinach. Me nastia gainuj haug makan Clifford. George Askamagiak, George Nadamagiak. Chigaganun wegish ganunaiga gadantikina gananak. There's a naganan here. We're going to Makanak Magazi, Sugar Juji, Buxton Munam, so-called Munyaun, Health Authority. Maybe going and Shnew Mujigan, and Shnew Mount Nijigan, and Shnew Ishjigan. We have a Matsika, Ganiganitamaga again, which Jikignamak, Bumunda Zonanan. Gonna get Shkunigan and Katamakan, Gawi Chiaka, and Shinok, Bears gonna go. The Gabakan, Chichigan of Magno Joya. Minaga Health Authority, or Donatun, I am go Bitamagan, gonna choke the mount, Argon Naton. Shina didn't get one to the mount, Maskuni Kagoya, Gazo the mountains, and the Gizio, which Nanok, which you are hard scare. Mina wena kahago tabitamagik, so-called Health Authority tabitamagik, Munyawan, Mina Regional Physician Services, Slurps Siganagnoch. Gary Nabago, we don't keep it on, Bejugan, Jimajamaga, Kanshin, Uichigo and Kajabok Sendamak, where Auxigam Wagaj Mamonamak, Mamonagadike. Minaga agents don't acknowledge when I got Kaya, Katigama Sol Kodajagaya. And Shinaz gets him shin took. As I'm staying on to Stamin where a Pidwak where Utena Sol Kodajagadik. Michuge here, Chinanaga, but the Makaza and Mshiniak. And Oshme Kataninaskamaga Munui that came down. Munuiji don gonna come to Ozok Maragi Jamaica. Egomina Osme, Chinagok, Chimunehamak. We don't keep it on. Gwenaka Kshipmojigan and Shaun of Gayagan. You wish new Natic, Kazagin up Nanok, we don't keep it on Janamute in Osme. When a Rabita Magwaka, Gain out and Snoop Mujigan. mina gawa biksab waja shkunaganan mina tribal councils gona ka digegino je osme menashik jmashkawatik kinakumutonam gegnich ga wich toyak aksio mujigan egots kain dot na nakmam na gona ka mutamago ka so-called health authority aja some dananyan shabak bum skamagan mina ga jot na nakmag na gona kantikiach dat gets in bezig wismant kidok nijake nsiake nishtanake mshinaka zo ga tantikiok kiabetsgo baksan mamlak Muniaune keina jigi modajo dat kuna osmejigi majutoach osmege gonajik kabita magwaka kegnechma kitashikyonanan minage mawanawgak asage chiganabajiga de no muniaune wa kitachimnanak kane mamajik sach skuniganik maga bijuk sach nikkendamen da osmem stehent kionetta gokwet nigan egachigonde bagen munugana kantka gokka kagini gana buatsa kitanch kinagana naga osme jigi majuta magwakka ka mutamagwak health authority michigo gain chigo ogmakana kamagasha bitamaga ka debagain mugo kyabis gain itsa jigas kamaga jas ka gant kinagna osme jigi munashik kumune munyaun higajigadik munyaub mujigon mashkiunikak mashkika sinaten Wabatamen kinotamen suga apleon kaya. Nego chmiaga kina mandogo shanum kwa wajia.
This time, while we're waiting for quorum, we'll have a 15-minute break. Thank you very much. If any of you know the chiefs who are supposed to be here, if you could nudge them through a phone call and tell them they're holding up the meeting. Thank you. Yeah. Mic to Chief Wabas, please.
I just wanted Chief Archie Wabas, Lake First Nation. The microphones that we have here seems to be not working, or the volume to the speakers, it's pretty low, and also there's an echo, and it's really hard to listen to every word that's being said through the speaker system. I wonder if we could kind of fix that, like going to You know, these speakers are two-way speakers. The best speakers are three-way speakers where they have high frequency, mid-range, and low frequency. And these speakers have high and low frequency. It's really hard to adjust on the PA system. May signal on these speakers. So this microphone seems to be working okay, but when you speak through these desktop microphones, can't really hear what's being presented. Yeah.
Thank you very much, Chief. As a matter of fact, when Elder was saying his prayer, I couldn't figure out what he was saying. And then again, he wasn't talking to me. I have been informed that there will be 3 chiefs that will be joining on virtual. So we just need one more.
We have 14. Oh, this one came in. It's only now
Oh,
one.
Elena came on? Okay.
So once those 3 join, then we'll
So
have,
once the virtual computer. So if you can get your coffee and whatever it is, and we'll start right away as soon as I get confirmation that we have the chief join us. Thank you. the executive management reports, okay? We're not taking any votes at this time, but it's important that we proceed. So I'll get my colleague here to introduce the people.
Hello, good morning. My name is Brenda Fox from the Shigogmag First Nation, and I'm your co-chair for this assembly. And I want to thank Clifford Bowe for welcoming us into your territory again, and also into the drum and the prayer. So I'm going to introduce the executive president and CEO of SLFNHA. I was going to call you Isaac Mann. so yeah, to do her reports. I got you.
Great, thank you, Wally, and thank you, Brenda. So before I jump into the executive reports, Janet and Brian are going to join. Also want to thank the drum this morning for the song, and Elder Thomas Spade for the prayer. And then obviously the chiefs, thank you for being present, and I know it's a struggle to get to 17, but we're working on that. I would also like to thank specifically Chief Bull and Chief Morris as the chairs of the CCOH and the board for being here today, so thank you. And last but not least, to all of the staff and the observers that are here, appreciate you taking the time to participate and listen. And then to the planning committee who are kind of running around and making sure things are running, just want to thank them as well. So they've been working behind the scenes to make sure that we have the tables set up, the meals are set, all the AV is done, cameras, videos, pictures, those kind of things. So I just want to thank everyone for that, and Laxul, thank you for hosting again. Appreciate making the space for us to have our meeting here. So, okay, so is the slide deck up? No. Nothing. There we go, thank you. Okay, so like last year, for those of you that did attend last year, we did something a little different. Instead of having 100 slides, which takes forever, we decided to do a highlight type of approach to the executive management reports. So you'll see on this slide that we're going to talk about governance a little bit, the strategic plan, community health services, regional services, and then finance corporate services. But in your kit, everyone should have received the annual report for 2024-2025. If you follow along in this document, all of the details of everything for the last year is in here. So we didn't feel it was needed to duplicate that into a PowerPoint presentation. So that's in your kits. Wrong way. Oh, there we go. Okay, so a couple of things I wanted to talk about in relation to the board. So again, thank them for being here. We've been working with I've been working with the board, and our team's been working with the board since I arrived. This is my third AGM now, so time flies. I remember the first meeting in Thunder Bay, and I was like, oh, what did I get myself into here? And I remember Chief Green making a comment to me from the floor that she didn't understand what I was talking about. So I took that, and we rebuilt some of the materials that we have for you so that it's more comprehensive, so that you have a better understanding about the work that we're doing. Part of that is governance. So the board, made up of representatives appointed by the tribal councils, meets several times a year. So we have 4 face-to-face meetings, and then we have meetings virtually in between those to manage regular business. So part of that includes a training component. So we've implemented since February of 2024 board governance training, so that they have the tools that they need to govern the organization in a more efficient and strategic way. We are planning for the next session of that. That will happen in March of 2026. The last one that we did went very well. We did shift a bit from a more Western type of board governance model to looking at a First Nations governance board training. And that we'll be continuing down that road, and we can share that information with you as well. So I take Chief Wesley's comments and and Wally's comments about looking at a more traditional governance model for AGMs. So we'll take that away and we'll look at that and bring that back to a Chiefs meeting in the future to talk about what that could look like for you. So more to come. And Cynthia referenced this already, the board orientation and policy manual. So new board members who joined, so for example, Rhoda and Wanda received a package probably yay high, virtually, of all of the documentation that they needed in order to understand their function as a board member and what work's been underway in the organization. So the board has 3 committees. The first one is the executive committee, so that's made up of the board chair, the co-chair, and the treasury secretary, treasurer. And then we have the finance, audit, and risk management committee that Brian leads. And then we have the governance and nominations committee that I oversee. And those committees are made up of board members that sit underneath the board to move recommendations to the board based on the financial statements, audits, those kind of things, risk management, which we haven't really gotten to yet. That work is underway. And then the Governance and Nominations Committee is really looking at what kind of training the board needs, and then any nomination requirements for vacant seats, and nominations for the Executive Committee when those terms are ending. So you've seen this many times. Just want to kind of lay a little bit of groundwork here before we talk about the strategic plan this afternoon. The strategic directions of the organization right now, so that started in 2022 and are being completed in 2027, are the community ownership, service experience, and health transformation. And the current vision of the organization is resilient and healthy nations supported on their path to wellness. And the mission is transforming the health of Anishinaabe people across Keweenaw by providing community-led services and a strong voice for their community health needs. So this is an important piece to reflect on. This afternoon we will be talking about evaluation of the strategic plan, and that's going to start today. And then that'll take about 18 months to complete with full engagement with communities and our system partners on how we're doing with the strategic plan and providing input and feedback into the next iteration of the strategic plan from 2027 to 2032, which we will then also bring back to the chiefs as well. So this is the one on day one at the AGM that Chief Crane said, I don't know what this means. So we've done a lot of work in terms of identifying the pieces of this, and we talk about, for example, the 35 years of SLFNHA. And this really kind of shows where we've come from. So the Scott McKay-Bain report, there's been the Anishinaabe Health Plan, which was evaluated. We had a review done last year. We reported that back to the chiefs. We have recommendations out of that review, which helps us to complete the strategic plan and inform kind of our next steps and operational work plans as well. And then we have past strategic plans that feed into each of the strategic plans moving forward. So where we are now is the 2022-2027 strategic plan, and we're starting that evaluation component. So on the, would be your right, the next stage of the work is where are we going? And part of that is that evaluation piece that we're going to be talking about, and it's actually under tab 13 in your kit, And you will, if you complete this and submit it, you will be entered into a draw, and we'll repeat this again later, but for 3 $100 gift cards, so fill it out. And it helps us to build kind of where we're going into the future. So that's this slide. So just some highlights, and I've talked about this before. We created a new team underneath my office. That's the Strategic Policy Planning and Quality team. Really, that team is the team that helps us to do all of this work. It helps us with getting the policy work done, the strategic plan work completed, evaluation completed, engagement with communities, partnership work with our system partners like Minayawan, Slurpsy, Tikanagan, NAN, tribal councils, and the list goes on. So that work is well underway now. So some of them are sitting over here. Jen is our senior director. She presented at the July meeting, and Bobby is sitting here as well. Also presented at the July meeting gathering in, here actually in Knoxville. So some of the things I just wanted to highlight here really quickly is we are focusing on engagement. So there is an engagement pathway. And it's in this annual report on how we're going to work with communities more closely, get more feedback from communities to help us drive the work moving forward, so that we have a good sense of where we need to prioritize. And an example of this is we've heard very clearly from the chiefs over the last 15, 20 years that mental health and addictions is a priority area. So we did a review of all of those resolutions. Ashley where's Ashley? We're sitting right here. She's the lead for the task force that was implemented last year through resolution, and we'll be summarizing all of that work for us so that we have the components moving forward that we need for mental health and wellness and addiction work. The other piece that I talked about, and I'll talk about it later again this afternoon, but in July we talked about having the right structure as an organization. So we are undergoing a review of the structure of the organization by program areas, and Janet's was the first one out of the gate, so thanks, Janet. She has a very large portfolio. We are going to be working very closely with Janet and her team and her directors to look at what is the right form to follow the functions of the teams that we have, and how are we actually meeting the needs with the structure that we have. One of the pieces that we've identified very early on is the need for a more robust structure for mental health and addictions, so pulling the components across the organization that focus on mental health and addictions under one team. So that's work that's underway, and we're hoping to have all of that work completed by April of next year and have some implementation of those changes in place, and we'll report back to you as those happen. The only other thing I just want to mention here is we are looking as well at research, data, knowledge exchange. What does data governance look like for the organization, and what are our priorities in this space? So I've asked for a research framework to be developed, an ethics model, and a data governance strategy that we will be bringing back to the chiefs through engagement to make sure that we have it right. And then the last piece is looking at accreditation for SLFNHA. So we are in the process of a primer. I think we're in step 9 of 10. It's 9 of 10, I think, yeah. We have a video that's been completed, and we shared it with the board yesterday. It's really well done. Once it's finalized, it will go public, and it will be sent to all of you as well, in terms of what that means for the organization and how that situates us for improvement moving forward. So some exciting pieces of work that are happening. And I think I'll leave it there, but there's a lot more information in the annual report, so take a look at that. And if you do have any questions around it, we do have Chiefs Forum this afternoon, and we'll be available to answer any questions as well. So I'll hand it over to Janet to talk about her areas. Thank you.
Good morning. So my my report starts from page 60 on this annual report till the end, I think. Yeah. So those are the areas that I oversee. In case you're wondering what I'm doing there. So I am, so at the beginning of the Yansnim, as a Nisumadana Nyanan, no, years Mandan Dananki Health Authority. Eko mistahi ke kono abatan kagyan katamak no kum ka sikakwe chaka no ats ansinuak. Eko asa MC no ats ke utan kik. Eko ke osme buko en nanakat stoaka ni ke kis osme an katamak hiwa aksi upmotsikewan. Eko nimenendan humaga kayan kian sakot asa den mamit nendan an pike kipunan kiobanen. Awi ang matse tsinapskosits kispin kinuyan kian. If you want my job, just let me know. So I just, I wanted to maybe highlight some of the things we have done over the past year. I know that you can read our annual report, but we have finalized our oral health business plan. We're trying to open the new clinic, the dental clinic that's at train station, the old train station. It's on the upper floor. Anytime you want to come and take a look at it, I think just let us know. We have, that has moved under Sandra Linklater now, and we're also completed a pharmacy review, so that's going over to Sandra as well. And we've been working with Laxul, transitioning, how does that land get transitioned over to Laxul so that we can build a primary health care facility there. So we've been working with them probably 3 years. They say we're getting closer, and looking at also the old accommodations also. So as you know, the old zone hospital is gone, the old hostel is gone, so we're looking at, we still need to do work around the area to make sure that there's no burial site there. So that's one thing. We have hired 2 medical directors in the last year, Dr. Yvette Emerson and Dr. Alana Morgan, who started in the fall, and she's in the back. And also, I would just like to acknowledge Dr. Terry Farrell at this time. She's also sitting in the back there. She wanted to come, and can you wave, Terry? She worked with us for 16 years, I think, in physician services. I phoned her and I said, can you come and help me for 6 months? And 16 years later. But she's still around here. She's going back to being a regular doctor, and continues. She loves being a doctor, I guess. Yeah. So I'd just like to thank her for everything that she has done. We are in the process of trying to sign a new physician service agreement. You will get a report from SLFNHA, I believe, tomorrow. And so you'll hear more about that. And we are collaborating with Minuyawin University Health Network to really focus on heart failure care. And they've been holding, I think they've done 3 or 4 visits now, and they have done clinics in Sulakaut and also have gone up to Sandy Lake, we're looking at increasing that service as we move forward. So it's a really good program for us to treat people before they get really sick. I know I'm not following the, I always do my own thing. One of these days I'm going to get fired for that. So we've had successful award of a Diabetic Connections grant. We got $2 million over 5 years, so we're doing some work around diabetes, trying to increase services in that area. And we've also released reports on childhood vaccination coverage, food affordability, mental health, and substance use, and that was done by Approaches to Community Wellbeing, and I think those have been circulated. And then we also did Kaya mo magak Akso and Cancer Report. We released that in August 25, and also the Shoko Apinewin report based on community perspective. I don't know if anybody heard me on CBC. I was interviewed really early in the morning, I think last week, around 6:15 in the morning, and probably nobody was awake. And then we finished the report, Hospitals Without Borders, and of course we did the Mental Health and Addictions Forum last November. So those were some of the activities that I supported. I'd like to thank everybody that worked in there in those areas, and we continue to move the needs of communities to address them. So we have the directors in the back, Ursula Larson, who's Developmental Services, Candy Edwards, who's Approaches to Community Wellbeing, April Derwin, who's Physician Services, and Katie Wantora, who's Primary Care, and I think Dr. Douglas was here somewhere. Oh yes, yeah, our public health physician. And if you have any questions or you just want to touch base with them based on the report, feel free to do that. Trish Harnchuk, who's Director of NODEN, is not here right now. She's had to deal with some urgent issues at NODEN. As you can see, we have done lots of work. A lot of teams have traveled up north. As you know, we still struggle with accommodation and workspace at the community level. But the health hubs that we've been putting in, I know they're small, but it has helped us to really address, trying to increase services at the community level. And there's some highlights that are there. I'll let you read them, and we are, yeah. So one of the other things I wanted to talk about briefly is the Jordan's Principle developments, and I think that as you know, there has been some changes. There has been, I think, challenges for communities to receive funding, and then so some of the communications that we got is that things like admin fees were not being funded. New group requests were not being funded. Carryover was not allowed. And they really wanted lots of information around group requests, including all the children's name, band number, date of birth, and all that stuff. And they will not cover non-medical support such as travel, non-medical respite childcare, clothing, vehicles, no longer cover sporting events. And tribal authorities and community applications have had, so some have received interim funding, a fraction of what they asked for. And I think lots of the tribal councils or communities have ran out of those funds already. So we're hearing things like people have had to lay off, their staff because they just have no funding. And so that's, it's really they challenging for, and it impacts the children, and that the services are impacted for those children that are already at risk, at the best of time. So right now, the health authority supports almost 4,000 children with services, and if funding is not received what we asked for, it's going to be a huge issue. We receive some funding. We received funding for Noden mental health. We received interim. We asked for 2.4 million, I think, and we received 675,000, which we probably spent already. Yeah, and we didn't. We have youth counselors that support the kids that come out for high school, and we haven't received that funding as well. So I'm just, I think probably Nan has been working at this as well, but I just wanted to let the chiefs know, the community leadership, that this is a concern for us as service providers, and I think maybe when Nan speaks tomorrow, they might also have more information for you. So just like to thank you and for coming. I know that you get pulled in a lot of places, and really appreciate your presence here. So thank you. Biwa.
Thank you. Just to, before they continue with the reports, to formalize the meeting, I'll call the board chair, for the vote on the resolution. Cynthia?
Thank you, Wally. So for Resolution 2501, we do have a mover and a seconder. So it was moved by Chief Russell Wesley and seconded by Proxy Alan Tate. So I would like to call for a vote. All in favor? Opposed?
Hello? What are we voting?
For the adoption of the co-chairpersons, Wally McKay and Brenda Fox. Sorry about that.
Okay.
Any opposed? Any abstentions? Carried. Migats.
Thank you very much, Board Chair. I would also like to call, we had on the agenda, I require a mover and a seconder. I require a mover for the agenda that we discussed earlier.
I'll second the motion. Chief Wabas.
Thank you. I presented that and there was no discussion. So with that, do I have any opposed? Do I have any abstentions? I see none, so we have agreement. Thank you very much.
Okay, I guess I'm assuming that we have quorum. All right, next presenter is Brian. Oh, Sonia, sorry.
Yeah, so you're going to hear from me again. I apologize. Monica Hemian is unfortunately not with us. Her mom did pass on Monday, so our deepest condolences to her and her family. So I will do her highlight of regional services. Once this is off I'll start, but we'll put the slide deck back up. Just a quick update on the Anishinaabe Wadizwin program. They've been working over the last year and delivered several cultural and education sessions. They've also supported multiple community events, as well as a grand opening at the camp, the Four Directions Lodge. Is Anna Marie still in the room? Oh, there she is. She's the director for the program, so thank you to Anna Marie for all of her work. Health benefits and client support. This is Sandra Linklater. She's been managing the Patient Navigator program, which provides support to clients in Sioux Lookout, Winnipeg, and Thunder Bay. We have had a change in the number of navigators in these 3 locations. So the number in Thunder Bay has gone up just to meet the demand of the services needed. And the number of navigators in Sioux Lookout went down by 1, just to manage the workload of patients traveling into those areas. So we've also had a SLFNHA-led technical table to address issues on non-insured health benefits. We've been providing updates to you on this for a while now. We are working with our counterparts at ISC to come to a solution on medical transportation rate for Thunder Bay, as well as a potential hostel site in Thunder Bay, as directed by the chiefs. And we continue to look for opportunities in Winnipeg as well for hostel services. And we are also looking at negotiating the hostel rate in Sioux Lookout with our ISC partners. So that's work that's continues to be underway. Information communication technology. So we have had a shift in the structure here. So IT, so I think the name has changed. Just IT? Okay. So information technology now reports to Brian under corporate services functions. And the communications team reports under Bobby, under our partnerships engagement team, which is in my office. So a lot of the work that we do in communications is very externally facing. So I wanted to have more involvement in that, so it reports through my office now. So we've done a lot of work here, so advanced security infrastructure, system modernization, security systems, and new network cabling that's specifically on IT. And then the internal and external communication improvements are currently underway, and part of the work under our strategic plan is the development of a communication strategy that is being drafted. Once that's completed, we'll share that with you as well. People and culture, which is human resources. This was reporting directly to Monica last year. It is now reporting directly to me as the CEO, because it is a organization-wide support function. So Jason is here somewhere. There he is, our Senior Director for People and Culture, doing a lot of work here. So we just had a great report to the board yesterday about First Nations recruitment, skills building, capacity development, and how we're working to increase the number of First Nation staff within SLFNHA. We do have 639-ish, 650 employees within the organization in various roles, and 42% of those are First Nations, which is a very high percentage. In my entire career, I've never seen a percentage of First Nation staff that high. So that's really great for the organization, and we'd like to see it higher, so we continue to work on that. So they've been working on it they keep working on it, but since last year, they've been attending career fairs, outreach events. They have a student bursary program, community recruitment efforts. I think it was 35 events you said you went to last year. Staff capacity building, succession planning. So who's going to come behind Janet? But not just Janet. I mean, it includes Brian, myself, Monica, other senior directors. We need to think about what our future looks like and who's going to replace us in these roles. So we continue to do that work. We have an HR system now that's in place that makes it more efficient and effective to manage the workforce that we have. And we are supporting policy development in this area as well. So client services, and I talked a little bit about this already in terms of the hostel work, but we have wellness action services on April 1 in 2024. So we have increased numbers of calls there. So there's about 20,170 calls for pickup and just under 36,000 clients. So that's a lot. That's a lot of transportation. I just want to say one thing about client services, and this goes to a meeting we had with the FNHA in BC, actually. They came to visit us as part of our knowledge exchange last year, and they were amazed by the hostel services that we have as an organization that does not exist in BC, and it rarely actually exists anywhere. I think first time I really heard about that was when I came here in 2023, well before that, but really getting a deep understanding of it. So I think that's something to be celebrated for the Sioux Lookout Health Authority and for the communities and the chiefs that mandated that to be put in place with Hostel 1 at the hospital or connected to the hospital. And that's a really innovative approach to providing support to communities in this region, and I think we need to celebrate that and showcase it. And we need to, honestly, I think we need to move this as the way forward to support our clients better with our system partners, with other organizations across the country, and we shouldn't be taking no as an answer from NHB. That's my opinion, and I will battle for that. I think that, I think that that innovation needs to be shared beyond just this region. So we are looking to do that, and I believe that she's not here, but there was a presentation that was done at the COO conference that happened as well. So sharing information about these services. And I'll stop there, but I just wanted to really end on a positive note that we are doing some great work, and that's really driven by community. So really hearing what you're telling us, and we're making those changes and implementing those programs and services.
And I'm just going to give you a brief overview of some of the highlights done in our area. Most recently, towards the end of the fiscal year, and Sonia mentioned it, we have started some work on risk management. Anna Hugo sort of returned from maternity leave and started on that work. We're creating a framework for risk management, and we're looking to apply a community lens to it. So with some input from Anna Marie Kakagamic, we're going to create a framework to sort of identify where the main areas of risk are in our organization and try to put it. Secondly, I just wanted to talk a little bit about the new fiscal relationship grant that we were approved for with Indigenous Services Canada this year. That was under the leadership of Pankaj Liliani, our Director of Finance. Unfortunately, he's not here today, but probably listening in. But that work, there was a lot of work for us to get approved for that. It creates a lot of stability for our funding over the longer term with ISC. There's sort of growth factors that are given for that funding. So we receive an allowance for like an inflationary kind of allowance and a population growth allowance for the funding that we receive. So year after year, we are getting 2 to 3% increment in increases because we are in the NFR grant process. It was new funding that was open to health authorities across the country for this fiscal year, so we're in right at the start. And it's been open, I believe, to communities for quite some time. I'm not sure if any communities in our region are in a new fiscal grant. But if you aren't, it's something that I encourage you to look into because it does provide some room for growth and room for flexibility. It's similar to block funding and being able to move your funding around to where the community priorities are, and the health authority can do that. About 58% of our contribution agreement funding right now is in the NFG, or the new fiscal grant, and we have flexibility that way, and we're hoping to move more of our funding into there over the longer term. And last but not least is real property, and that's under the leadership of Daryl Quident. I'm not sure if he's still here. Okay, just raise your hand there, Daryl. He's a member of Lac Seul First Nation, and he's done some great work with our real property team. And what I want to highlight is some of the work that we've done in terms of putting health hubs into our communities. So over the last year, we've added another 2 over the last the 24-25 fiscal year, and then 2 are just being implemented now. So we had before this fiscal year health hubs in Webequie, Cat Lake, QA-Win, and Muskrat Dam. We've added health hubs in Nabinimik and Mishkigogamang, and we are now going to be opening health hubs in Sandy Lake First Nation and Wiagamau or Round Lake First Nations. So those health hubs help us deliver service on the ground in the communities without having to negotiate with ISC or the schools for space for the delivery of service, and also provides accommodations for our employees in communities so that we can stay overnight and deliver service over a 2 or 3 day period and just have better impact on health outcomes that way. That's all for me in terms of what I want to highlight for my program over the last year.
Hello. So thank you for the reports. At this time, we're going to give the chief some time if they have any questions to the reports here. Any questions? Chief Archie Mobas.
Thank you. I have a couple of questions on the reports that are presented. On the non-insured table, you mentioned that there is a non-insured table. Okay. There. On page number 10, health benefits and client support. SLFNHA led technical table established to address issues with the non-insured health benefits program. Could I get an update in terms of what's being discussed? What are these issues being discussed and addressed on that table? That's my first question.
Thank you, Chief Levis. Yeah, so there's two different processes that are underway for the non-insured discussion. Sandra Linklater, who's the director for the program area, has been working at the technical tables with ISC and HB to address barriers, so medical transportation, accommodations, meals, missing appointments, being rescheduled, denials, not having access to appropriate vision care, dental services, pharmacy. What am I missing? I think that's all, yeah. I mean, basically anything that's NHB, that table is trying to work through those issues. What I can ask for is a report from that table, and we can share that with the chiefs. The other table that's a technical table is specifically to address the hostel services and the medical transportation services that SLFNHA provides. So that technical table is made up of, Sandra participates in that as well, but Brian and Monica participate in the technical table. So I'll hand it to Brian to give a quick update on that. I participate on the executive level NIHB table with the ISC counterparts, both regionally for Ontario and the federal partner. So that's the ADM, senior ADM that oversees NIHB for the country. We have a meeting coming up at the end of this month to try and make some decisions about how we're going to move forward with the rates for the organization, because we haven't so far agreed on those, but Brian has more details.
Okay, I was trying to find out if we have this SLFNHA technical table established. One of the pressing issues is the transportation of the patients coming out from our communities to go to their medical appointments in Solikot or wherever, Thunder Bay. And I think that's the problem is administrative. I think the way transportation accommodation, transportation, especially on transportation, arrangements are not, are not booked on time, and there are some delays, and it's affecting our patients, our people accessing medical services. And this has been an ongoing issue, although we have a technical table or a table with the non-insured, but there seems to be no immediate solution. I think the problem is in the office administration of how they administer, how they operate their office there. I think that needs to be immediately corrected, resolved. If you could just answer the phone call. There's people that call directly to non-insured sometimes, and nobody's answering the phone. They're trying to know if they're booked or if they've been, if their flight has been booked and everything, things like that. So there seems to be the problem could be pinpointed at that office or at that location where whoever is making that travel arrangement. So that needs to be fixed, like right now. The other question that I have is on the following communication technology, internal and external communications improvements. The communications, like one man had experienced a telephone signal loss for over 2-3 weeks, and we weren't able to communicate the nursing station or our police services through local landlines. And I had called I had called Nan and Kenneth to help me. And we finally reached the Vice President in Bell Canada to address the problem. And they sent the repair crew right away the following day to fix the system. So why I'm addressing that is there a way to monitor that? Is there a way for SLFNHA to kind of monitor that we have a working communication at our nursing stations, at our health centers? You know, it's really important that we keep the phone system and communication system at the nursing station. So if SLFNHA could keep an eye on that too, and kind of have, directly communicate bill executives. You know, if there's a problem in our communities in terms of telephone system or something, and SLFNHA calls bill executives right away to mitigate and solve the problem. That's one of my recommendations there. And the other thing on the following page is 11. Client services, wellness checks, staff cultural training, Thunder Bay transportation. The missing part there is accommodation. And I wanted to talk about the accommodations. You know, there is this organization that we have recommended that we buy a hotel to accommodate the patients that are coming from our communities up north. And we've talked to ISC about it, and there seems to be parties involved. Our organization has to consult with SLFNHA to try to get the financing in place and then the rates in place to buy that hotel. But that didn't happen because there was this, the intention was SLFNHA wanted to look at the, getting its own accommodations in Thunder Bay, and we were dragged down from that opportunity to get the accommodations in Thunder Bay. We really can't, ISC was willing to help, but it's between our organization and SLFNHA that didn't really work. So we had a missed opportunity there to have our own patients' accommodations in Thunder Bay. I just wanted to mention that. I think we need to work together. If the chiefs want the accommodations in Thunder Bay, I think we should look at that as well. Amigos, thank you.
Yeah, thank you, Chief Wabas. I've taken some notes. So we'll do the technical table update report. We'll get that sent out to the chiefs. We do also have, I think Dan is in the back, right, somewhere? Oh, yeah, right. From ISK, so he's hearing this as well. The communications piece, we can certainly look at this. I think this has also impacted us as an organization, not having access to the communities to make sure that services can get in there, and so that communication flow is important, so we'll explore that. And then the accommodations piece in Thunder Bay, I agree, there's definitely a lost opportunity here, and we are committed to looking at the solution for Thunder Bay. We do have a mandate from the chiefs from 2023 to look at a hostel in Thunder Bay as well as in Winnipeg. So we'll take that offside and have a separate conversation around that on how we can come up with solutions to address that.
So are there any other questions? Chief Moralun, Michigagwan.
Hello. Before I have a comment, it's not so much a question, I don't think. It's just more of a comment or an idea or something I'd like to share with the other chiefs and anybody that's going to be listening with some of the comments I need to make. But before I start that, I'd like to extend my condolences to the community and the losses that we're experiencing as communities and here in Lac Seul, and also some of your staff from SLFNHA, and the losses, I say, you're in our thoughts and our prayers. Also, before I like to continue with my comments, I also like to acknowledge the opening this morning, the acknowledgement of the drum, the opening prayer, and also just acknowledging that that we acknowledge the gift and the gift of life and the gift of breath, and to be thankful for our families, for our nations and our communities. One thing I'd like to refer back to again is the non-insured issue. One of the things that we've been exploring and contemplating in Mishkigawagmang is how do we address these issues. We know what our issues are collectively as a nation in our own communities. And it's always a constant, if not the same issue that we're experiencing at our communities. And sometimes we're forced to kind of take back what we need to take back to our community. How do we resolve those issues to try to make it better for our people? And one of the things that we have approached, and I had a good discussion with one of our physicians here this morning, is how do we address, or at least try to address those immediate concerns we have with our people. Prior to coming here yesterday, I had a meeting with our head nurse, and some of those issues with non-insured we discussed in the last 2 weeks. And again, this is consistent, not just in Mishkigawagmang. I understand every nation is experiencing this, that some of our members are missing out on appointments for whatever reasons through non-insured not being up to par with some of their mandated responsibilities. And how do we resolve that issue is the question. How do we immediately try and fix that issue? And one of the things that we'd like to explore, and this is, I guess, a question to SLFNHA and the technical staff, that if Mishkigawagmang was to approach to hire their own 2 or 3 navigators to try and address those issues we have at home to try and help our patients or our community members, how do we go about doing that? Is there technical support or some kind of direction we could look for to look at that? And again, this is trying to find solutions to these issues that we're experiencing on a daily basis. Because it's sad to see we all know these stories. It's sad to see when we have our own community members suffering because of their medical concerns and issues. Again, and I'm going to share this story, and hopefully you don't mind that I'm going to share this story. It shouldn't take sometimes what, and God bless her heart, and this is sometimes we need to do to take care of our own people. She told me a story about an incident there with a boy that got a piece of metal in the eye, and to try and get this done and address this medical issue quickly, she had to take upon herself to pay for her own transport to get that boy to a medical facility to get addressed, fearful that the kid would lose their eye. Like, how do we address those issues? It's a daily thing. It's a daily occurrence. And, yesterday when I drove up here, I was just racking my brain. How can this be? How can this happen continually with our people? I don't get it. Like, again, and for me, it gets frustrating as a leader when you try and help out our people that are the best of our abilities because of whatever it is we depend on. And unfortunately, sometimes we depend so much on this non-insured benefit branch that we know that they don't come through. So how do we take it upon ourselves to try and take care of our own? And again, it goes back to self-governance, self-determination. Yes, it's a long way down the road, but it seems at the same time, those immediate issues occur daily. So these are some of the things we're looking at as Mishkigawagmang. Collectively, you'd like to do it as a collective, but sometimes you have to take it upon yourself to try to deal with the situation at hand, because that's how much it means to us as a nation to take care of our people, their patients within our communities. But I get it, collectively, sometimes we have to take care of each other as nations too. And you don't want the less and I don't mean to say this, but sometimes we don't, some of our capacity levels in our communities are not as equal as the other communities. But we don't want our partners our partner nations to be left out either. So as a technical entity, not only at SLFNHA, but also I look to NAN, how do we address this? Because to me, I've been chief now going on my second term, but I've seen this and heard these talks for the last 25 years. In all due respect, it seems like sometimes we're just spinning our wheels. We need to move forward. And again, I don't like hearing those stories that our kids are suffering, our elders are suffering, our community members are suffering, when it seems to be that we're always going to the government to beg of them. And to be honest, I'm not a beggar. I hate begging. So how do we address these issues? As far as the communication part of the thing too, I just wanted to add that comment in there. Again, when I was meeting with our head nurse yesterday, they just got this new satellite phone system installed, which works within the community. Obviously, when those issues occur, when the power goes out or lines are cut, and that happens frequently in the north. And she was telling me that the old satellite system that they had, that she had to go pretty much stand around on the outside and not move to get through to wherever she needed to get through. And now she's got an updated system that will basically call out of the clinic to address any immediate issues that occur. And again, up north, we're always experiencing those outages, not only power outages, but also phone line outages that do occur, and there's emergencies that do occur. So that's good to see that maybe that's something that they could probably implement all over Northland in our clinics. But I think that's all I really wanted to say. I just wanted to throw out there something to think about. And Mishkigawang is strongly thinking about, how do we go about taking care of our own, but at the same time keeping in mind other nations, because we feel that desperate and we don't like having our people suffer. Thank you much.
Thank you, Chief Moon. Am I on? There we go. Yeah, I agree with you. And I mean, I've been working in this field for a long time. And I'm still having the same conversations 25 years later on non-insured health benefits. So there is a barrier here to addressing these issues with our system partners. So part of what we've been trying to do is identify what those issues are, because we know what they are, and SLFNHA has developed a long list. So your medical transportation story is one of thousands, and that's really unfortunate that we have to deal with that, because this system is not set up correctly to actually meet the needs of the communities that we're serving. So we've consistently been raising that message with both ISK and NIHB. Part of the work moving forward, and the Chiefs Council on Health has talked about this in their 5-point strategy around First Nations authority and control over health. You have an inherent and treaty right to health, and every community in this region has a right to control their health services. So part of that work includes looking at what that means for the region and how do we get there, including SLFNHA in terms of potentially taking over some of those services from ISK and NHB. Medical transportation is one of them. It has been identified as a priority area. But the issue is, if we take over a program or a system from ISK that we cannot make changes to or isn't adequately resourced, well, that'll create other problems. So we're trying to work through that. The other piece, and I talked to Chief Wesley about this, is do we need to look at a legal strategy from the chiefs in this region to address this issue? SLFNHA isn't that entity to drive that work, but NAN is I can't see, is she's here? Deputy Grand Chief Anna Betty is here, and part of what I talked to her about a little bit earlier was exactly what you raised in terms of the barriers and the issues with medical transportation. So I think that we need to look at a partnered approach on how SLFNHA can help from a technical side, because we do have the information, we have the data, we have the numbers, and the stories that can help support this work moving forward from a political, legal perspective. So I hope that that helps. I know it's not the answer, but it is part of the work that we've identified moving forward, is to try and address those issues that you've raised. So I appreciate that. And we will look at what the potential support services are and how we can play a role in the satellite phone system, because we do need to have access as well. So Brian, I'm putting that on Brian.
Thank you. Is there any more questions? We're going to close of Chief Wesley, Cat Lake, then Lorraine. Or Lorraine, you guys want to arm wrestle first? Just kidding. Okay, ladies first. Okay, Chief Crane.
I beat him.
You got to press the button on your microphone.
I just wanted to mention about patient navigators. I really do believe they're very much needed in, with the patients that travel in and out of the cities, especially. I was recently in Winnipeg with my grandson for almost a month. He was in a serious accident. And we were in a hotel. I think it's meant for patients. Not once did I recognize one person the whole month I was there, because they're all from northern Manitoba. Anyway, I'm just telling that part. But I found the patient navigators there at that place. They were very helpful, but they also couldn't do some things that, because their hands are tied, they have different, they have rules that they gotta follow. And one thing that I found really discouraging is my grandson was already in the system at the hospital, and every appointment we had to go beg for a ride. No, you gotta call NIHB. I thought I was so silly because we're already under a lot of stress. I end up spending a lot of my money going back and forth because I'm not going to call NIHB for every ride. And I was just thinking about, I wonder what happens to everybody else that has to be in that system. Because I know how it was for me and my grandson. And I'm not telling you that because it's our story. I'm telling you because you need to know these things that go on with the patients out there. And I recently had contact with a navigator in Thunder Bay. She was busy being a social worker, trying to find a mother and back and forth with calls, and I felt really sorry for her, and I don't really, didn't really agree with that either, because I don't believe that's a navigator's job, to call the chief and then call the health director and blah, blah, blah. It was just a real big, and there was reason to be concerned. But I'm just wondering about, what kind of training is provided for our navigators, how to direct them to handle crisis. So I just wanted to bring that up with the patient travel in Winnipeg. It's not easy. And if you can't speak for yourself, I wonder how long you sit there, you know, and nobody will do anything. Thank you.
Thanks, Chief Crane. I'm going to ask Brian, do you know what the navigator training looks like for crisis? No, Jason. Did I say Bobby? I was looking at Bobby, I said Bobby's name. Jason. He does not know. I'll look into that for you, Chief Crane. I think there is. Yeah, there's 3 in Winnipeg, there's 4 in Thunder Bay and 2 in Sioux Lookout now. But the question is around the crisis train, if they get crisis training. Is Sandra online? No? I'll follow up on that for you.
I just have one more thing. You mentioned there's navigators in Winnipeg for Ontario. Well, the ones we dealt with, they weren't for Ontario. They were for Manitoba. So I don't know how they choose where the patients go when they get sent to Manitoba. They didn't know anything about us in Ontario. The other thing that happened was he was not entitled to home care because we were from Ontario. That's another thing that happened. So he had to go back and forth to the hospital for his care.
Okay, Chief Wesley, Cat Lake.
Legacy. Not sure how I wanted to phrase the question, but I guess I just wanted to follow up on, a lot of the materials that we're discussing here and issues being raised about non-insured all go back to a number of resolutions that have been passed, the last one being 2307 in Eagle Lake, that sort of reorganized a number of resolutions that were passed over time. Like 1523 as an example was a call for a declaration of public health emergency. And I don't recall exactly what the wording on the resolution was, but it was a statement of a declaration of public health emergency and that certain things needed to be done. And now I'm sitting here looking at the health benefits and client support, and then there's the other one that's talking about the ongoing issue about non-insured and accommodation. But yet I've yet to see like a firm strategy on those issues. There's talk about a SLFNHA-led technical table. Who's on the technical table? Like how are we encouraging input into this? Because obviously communities like ours that are dealing with the transportation and accommodation issues also have solutions to these problems. I think the key point to what I want to point out is the fact that there's a number of resolutions that have been passed that should have already established the core issue that we're dealing with here. That's the provincial and federal control of policy control. The only way we're going to address these changes are if we have the ability to influence policy and therefore influence the funding regime. I believe 2016 was the first time I raised the issue of mental health and addictions, and right until current. And during that time period, the glaring factor is always falls back on Dan Abdi there and the policy folks. As the barrier is just simply policy. And I don't see why we haven't addressed that very core component, because all we're doing is just spewing rhetoric every meeting, because we're not looking at the core issue. And just recently, I was able to have an initial meeting with the ISK folks and FINIP folks to try and identify who the Ontario representatives would be at a trilateral table. That's what we need to do. That's what we need to do in order to implement those resolutions that have been passed for the past number of years. There's a few other chiefs that are going through that same experience, but we're moving in that direction, and that's what we need to do. But the thing is, FINIB and ISK has to be receptive to that, along with our Ontario partners. That's the only way we're going to address these issues. Otherwise, we're going to be sitting around here talking about the same thing again next year. All right, those are the comments. Thank you. And it's lunchtime.
Thank you, Chief Wesley. I appreciate those comments. And we've identified those issues as well. So, and you and I have talked about this multiple times. We are looking at the past resolutions and pulling those together in terms of what is outstanding. So before my time, like, resolutions often sat a little bit idle. So I'm not going to lie. Part of the work is the cleanup, making sure that we are pulling together the information that came out of those resolutions and putting them into our work plans, and making sure that they actually get done. So that's work underway. So the policy team that's here is working on that. And then the other piece, I think you're completely right. Policy is just policy. It is not law. So I think we need to start looking at it from that perspective. And that's part of the work that the CCOH has identified in terms of that legal strategy around not just NIHB, but all programs and services. We are also, as an organization, kind of at the mercy of our funder a bit, in terms of how we can roll out some of these programs and services. And I strongly feel that we should have 100% flexibility in terms of how we can actually serve the communities in our region with the funding that we receive. So we are working towards that. Chiefs Committee on Health, or Chiefs Council on Health, is aware of that work, and we have that 5-point strategy that's going to help us get there. That's not going to happen overnight. That's a lot of work. And part of the conversation moving forward is going to include things like pieces of work that are still outstanding. So, for example, like the partnership accord that some communities are a partner on, the 4-party agreement. There's still things outstanding in those pieces of work that were never completed. So we're looking at everything. We will be bringing to the chiefs at some point a conversation around governance, and what does that look like for this region, and how do we look at it from a First Nations perspective rather than the Western model that has been forced onto the communities. So that's all that work that's in place or in flight, which will address some of these issues, but it's not going to solve everything. So we still need to work with our system partners, and I appreciated Dan in the back. Lisa's unfortunately not here. She had a family emergency, so we will be bringing those issues forward. We have a joint executive table with ISK where we've identified these priority areas, and we are bringing these issues forward that you're telling us as an organization. So, and we'll report back to you on that work as well.
Okay, we got a report that the food is a little late anyhow, so Chief Wesley, you can come back. It's going to be, he was a few seconds, he raised his hand a few seconds earlier, so I'm not going to ask for arm wrestling. So it's Chief Wabas and Chief Donnie Morse.
Quickly, hello? Quickly, I just want to mention the other thing here that I'm experiencing. When the patients leave to attend their, to go to their medical appointment in Sulacot or Thunder Bay or wherever, sometimes I get a call from them saying that we're not our travel has been canceled, or non-insured is not paying our way back for some reason. For some reason, they missed their travel on that particular time or date. And if they miss that, non-insured will not rebook them. And that's what's happening. So what happens is we end up paying back their airfare all the way from their place of destination to Wanaman. So I think First Nation, my First Nation is incurring that debt. So what I would like to see is my First Nation get refunded for those costs that we've been incurring. It's the responsibility of non-insured Health Canada to help and support our patients' travel wherever they are, whenever they're coming back, even if they miss their airfare, their travel at that time and date. I want my First Nation to be refunded for those costs. We're not supposed to, we're not supposed to pay our own medical transportation. It's the federal government that has to pay that. That's the agreement. That's the understanding in our treaty. So I don't want my First Nation to pay those costs or to get into debt just because of that. It's a responsibility of the federal. Okay, I just want to make that clear. There has to be a mechanism where we can get a refund. So in your discussions with the ISC, I want that. If we're incurring those costs, I want these refunded. The other suggestion I would like to make on Chief Russell's comment is that when we have a table with ISC in dealing with non-insured matters and issues, I think we should be clear. I think we should be clear of our purpose and our intent and what we're trying to accomplish, what we're trying to achieve. If it's a patient transportation issue, and that needs to be resolved right now, right there and then. You don't need to have a long discussions and long debate on that with ISC and non-insured. They have to say, okay, we're going to fix that. And they have to fix it because there's so much stress, there's so much anxiety happening with our people because they're not sure if they're going to make it to their appointment. What's going to happen to them with their illness, if they're being rebooked again for another 3 weeks or 4 weeks or something like that. So then you want to get that specialist or a doctor that they're trying to see. So that's why we're saying when we raise issues like our patients, our people want to see the doctor, and non-insured has to be there to provide that support, transportation, to get the patient to see that doctor. Panama, we was going to do now. Kaya ako sa Atsoya, ganino gayin to Atsoya. We were to have much masculine. Mr. Simai Samat Seg, non-insured transportation. Ikakuya kaya tamano at ganag taxi. Kawi nasko at masculine. So I'm very concerned about that. It's been an ongoing discussion now. I think we should tell ISC fix that now. Nongo mo ko tsika ko mano seg ban hiwa toka. Tsika ko mano tuwa pan hiwa tsika ko we pat we charge kanak gaganto the mod go shot go in dog mod maskin. Okay, me guts. Thank you.
Thank you, Chief Wabas. We'll certainly raise this with our counterparts. Again, I think we need to come up with a strategy, and I don't see Chief Wesley in the room, but I have had a conversation with him as well about similar issues and the need to develop a strategy for the region to address all of these issues, so that we can actually see some, positive outcomes from those conversations we're having with ISC and NHB. I think, the important thing is that we are hearing what you're telling us, and we do raise these with those that are responsible for this program, and we'll continue to do that, and we'll report back to you on how that's going.
Chief Donnie.
Archie Wabas, Gan Mudak. Crisis we have an outstanding amount invoices ISC Shamoka totaling $760,000. You're going to get to have it in their hands, so when audit comes in, if I have a deficit in that, that's what I want to reference, that amount. Because recently we had 4 more youth that drank body spray, 3 before that, and before that 2 that we lost. So these crisis, guys saying it's taken a toll on us. And I see when you want to access funds, so you guys already have funds. It's not fair. And I think these new leaders coming in, I think we got to start preparing them for them to start addressing those issues legally when they need that. I think as we all know, 25 years is a number referenced here. Just spinning our wheels, eh? So I think it's time we start planning with these technical tables, again, like to look at these issues. Yesterday, my aunt called me. I've been moved out of Superior Inn, and she's been there as a month. She was medevac, eye surgeries and all that, and she's an elder. And what kind of upset me yesterday morning when she called me was they asked me if I could pay my room for 3 nights and also pay for my meals. And they know I've been here for a month. Where am I going to get monies to pay for those accommodations and meals? So I called one of the navigators over there to go over to her because she was in the lobby. And then I found out later on that they transferred her here to Sulcout, and yet it's against the doctor's wishes because they wanted to keep her over there because of her eye surgeries. So just bringing that to the table here, how non-insured is treating us, even though our elders, our patients leave the communities. We have complications coming out here.
Thank you, Chief Morrison. I appreciate that context, and we'll raise that as well. There's been several instances like that where patients are actually transferred when they shouldn't be against physicians or like diagnosis or direction. So we'll put that on the list of issues to raise as well.
Okay, thank you for all the questions. Is there any more questions?
We should put that ISC guy here in the middle and give him crap.
Okay, is there any more questions? Okay, one of the elders, I can't see your name, sorry.
My name is Elder Edith Boss from Wiagamow Lake First Nations. I'll be very brief. First of all, I want to comment about this ongoing self-determination directed by the First Nations chief is going well in my view, and also the SLFNHA has its own empire that is progressing very well and growing well. That is visible and seen and noticeable. One of the things that I have a question on is, after reading the booklet here that was provided to us, is in regards to the community well-being approaches. There is a question that I have about community workers. In the first hand, there is a lot of teamwork that is ongoing to help prevent and manage diseases like diabetes and cancer. And there's also continuing promotion of materials to be read by people. My question came when I was reading about the community workers, that there are training opportunities for them, and that they are receiving help in that area. My question is how many workers are there in the community to do ongoing hands-on work? And what services are available in the community are my questions. My question came because of being being in a healthcare work in my past, where there was a education on diabetes, and I was still there when there was the first I believe it was a study that was done by Dr. Harris in Sandy Lake, and from there were education materials that were developed for workers to educate patients. There was also a community outreach in the communities that the workers went, and they involved the community to present what they have to give us to provide these informations based at the level that they're in. And one of the things that we used was radio. We did education by radio. So that's one of my questions, is regarding how many workers are there actually in the communities. There should be some visibility information that can be read into this as well, so that we know what community workers there are and what community service they are in the community. Thank you. Miigwech.
So the community health worker diabetes program is, we support, I think there's 21 communities, 21 workers in the community. They're not our employees. They're employees of the community, but we have an agreement with the communities for us to work with them, to train them, and their focus has been to support people with diabetes that their sugars, like they're out, out of control, to try and do intervention so that they don't get complications. So when they go in to see the clients, they check, their blood pressure, they check the medication, they check their feet, make sure there's no sores, and check their sugars. If something is out of whack, like their blood pressure or sugars, then they would refer them to the nursing station, to a nurse or a physician, so that can be done. So we have money just to have some coordination and some management role at the health authority. and the rest of it gets used for training. So we provide training probably a couple times a year. We sponsor them to go to a diabetes conference as an example. And so we had only 500,000, and we got an increase of 600,000 last year. So we only have like 1.1 million for all 33 communities to do some work. So we provide them with tools to use and education material to use when they are interacting with their clients. And they're only specifically working with people that are out of control, trying to intervene at that level. So we're moving forward to see how we can further strengthen the diabetes program. So that's one of the things that we'll be looking at in the coming year. Minuyawin receives funds from the province, and we're looking at maybe transitioning those resources. They're having a hard time recruiting, just like we do too. But that's nearly not enough to deal with diabetes in our community. We just did a report there this past year, and then we just did another report, Shogawa, and it's in the binder, trying to see how we can support communities deal with diabetes in their communities. There's probably 30% at least of your population have diabetes in your communities. So it's a huge, huge problem that we need to work on together. And those existing workers that we work with, some of them are diabetes initiative workers, I think they're called. And then some of them are CHRs, some of them are personal support workers. So it's whoever the community decides that they want them to focus on diabetes. So that's what that program is. It's a good model, and I think that model, community health worker model, could be applied in any service area. So, thank you.
Just a follow-up. So Chief Crane, your question about crisis training for the navigators, they are scheduled to have that training in October. So it's done.
I think it was Russell. Did you have your hand raised? I think it was Chief Russell and Lorraine Crane again. So I'll go with Russell this time. Then Lorraine Crane.
Well, I just wanted to before I begin, I just want to acknowledge the hard work of the Chiefs Committee on Health, the technical staff, the management. Very good work. But I think sometimes that you need to be more aggressive, I think, in my opinion, because at the end of the day, when we're trying to implement resolutions, all the resolutions are program-based. They're confined to program management and implementation. When we really need to get at is the ability to implement resolutions such as the declaration for a public health agency that we did a while back. And in that resolution, you need to engage a government-to-government thing, which would allow for the move towards transfer payments as opposed to program-based funding. That would allow us to focus on needs-based funding, because what's happening is we're getting caught in the cycle of program funding, and that creates and fosters animosity amongst the communities because of the silo issue. So that's all I was saying. That's the statement I was making earlier, and that we really need to be aggressive, with our boards and our special panels that are implementing these resolutions, and that there needs to be more attention to putting the noisemakers up there in the front, like people like me, I guess, and Archie and a few others. But I think that's what we need to do, because we certainly need to influence policy. Right now, we're not doing that because we're just confined to administering programs. So yeah, you got you.
Chief Crane.
Kaning Ganesh, Gagagitsi. I just want to say thank you for acknowledging what I mentioned. I think that we as communities need to be more. We need to do more, and I don't mean to put anybody down in this here as chiefs and staff. Nobody told me we have a navigator in Winnipeg. So whose fault is that? I think the communities need to know who their navigator is if they should go to Winnipeg or Thunder Bay. And it's not because Donnie showed me the list of navigators for, and I didn't know that. So anyway, thank you. We need to be more vigilant for our communities. Well, when it chinana gachengo ag tanshrabe mnana kima George kima tanshegani George. But sometimes we don't know where to go or who to help, who to reach out to.
So I just want to thank you, Chief Wesley, for your comments, and I totally agree. So I'm going to knock on your door when I need some noisemakers. I just a little bit of context about where I come from. I used to work at the AFN for almost 11 years, so I was very noisy. I fought against FNIB every day. I know how to navigate that pretty well. But in my function that I'm going to really be noisy on is the wildfire situation that happened in communities, and this issue that came up with ISK in Ontario, the province of Ontario, was that as soon as someone's evacuated from community, they were being considered as a non-community resident, and they could no longer access services through ISK. And I don't think that that's right. I've raised that with ISK region, and I expect that we're going to have a debrief after this to talk about how do we change the policy, because the policy does not work for our community members. In my opinion, those community members are still community members. They are just displaced because they have to be evacuated. They are not moving to Thunder Bay. They are not moving to Toronto. They are not moving to Sudbury. They are still community members living in community. So they should still have the same services that they had in community. So I'm going to die on that one. You have that saying where you're going to, which die, hill you're going to die on? I'm going to die on that one because I don't think it's right. So I'm going to push on that. Dan's kind of laughing in the back. He knows I'm coming. Because that was just really, in my opinion, inappropriate. Especially when you're dealing with such a traumatic event of being evacuated from your community. You don't need to worry about where your services are coming from. So we'll work on that. And thank you, Chief Crane. I appreciate your comment about raising more awareness about who the navigators are and how to reach them when patients come out for travel. So we'll have our communications team work on that as well.
Thank you very much. With that, we're going to break for lunch. and we'll come back at 1:30. We will ask the elder Sarah Yellowhead to to give a blessing to the food. Okay, Sarah.
Oh. Hello. Good morning and good afternoon to everyone that attend to the meeting. Mi Gretchen den dan magagi pitagosnan. Kagi pe tagosnan manake to attend to the meeting. Mi etas kese ma jemstikian chikagoich magishaman to chisawendang meechem. I'm going to ask the Creator to bless the food that iwe kawi michgatig. Uinaniska kinage gono kendan anin Asia gibmatis huna. He knows us how we feel. Ke kawani hang awya kasagi hang kikikene me komen. Kawi sagenda man gibmatis huna. Hoe ka nonda magenin kawani hagani wach kenin ndokinikon kenin machine awya kawani hako kenin kasagi hako. Miwe ekitoan ho chonjika goetean chui chihaga niwach uwisagenda mo innoage ukuenok kawisagenda mo wach kawani hawach kasagi hawach ogishaman togika goechimen hoe kinage kon kaisek hoe magayang ma shibahi kishikon kayayang Kiinaniske kongi peotte apantanan kakkinake kon kaissaan bemaatissuhennan kika koichimen kisemanto ke hoe miichem hoe oechimen oskagoang huma nimavitanen chikanan kienta chakonan hoe chisoentaman miichem kawi miichiang eka koichimenan kiin kakkinake kon ekkendaman anin kaisiang bemaatissuhennan Kintas chisointaman kakkinakekon chimenoskagoag oe miichem kawi miichiag. We know in Jesus Christ, amen.
Yeah, just an announcement that they want the elders and they requested that the elders and the invited guests have the meal first, and we'll return at about 10 to 2. fire.
Wherever there's a green cup.
Good afternoon. If I can have the delegates back, we'd like to call the meeting back to order. Thank you. Can I please have the delegates take their places, please? We'd like to get the meeting back to order. I've been requested to have a slight order of change, a change in order. There's going to be Sulcoat First Nations Health Authority and Tiknagan partnership MOU signing. So I think we will deal with that right away and do the audit right after that. So I will get the people involved in the signing to come and join us up here for that event. And if we can get someone to explain what it is going to be. Sonia.
I brought my own pen, but it was already pen here. Hello. Thank you, everybody, again. So we're going to get started with this, and I'll just talk a little bit about why we're doing an MOU with Tikanagan and SLFNHA. So I talked a little bit about partnerships this morning, and this is a prime example of what we're trying to do as an organization and partnering with Tikanagan to address, common vision, common priorities, and working together to do that, to support children. Really, it's looking at how do we support the advancement of wellness, how do we work together to do that as organizations that have an interest in children and families. So that's a nutshell purpose. The agreement really kind of outlines the intent of that, what the scope will be, our commitments of working together. I talked about joint priority areas and work plans, looking at how do we address mental health and addiction issues from the perspective of both of our organizations and supporting children and families through that. And then really looking at how do we develop a tangible list of realistic goals that we can actually achieve together. So that's work that the team, the strategic policy team is helping to support as well. So we're looking at mental health and addictions, because we heard that very clearly from the chiefs, that this is a priority area. Youth mental health and wellness, family healing and wellness and prevention, as well as training, education, and capacity building. There is no funding component to this kind of a partnership agreement. It's just the agreement to work together to address these issues. So Thelma has joined me today to do a signing of this MOU, and I'll give it over to her to say some comments about Tikanagan.
Miigwech, we've been talking for a bit of time here to work as partners. We talk a lot about what is it that we need to do to have thriving generations, future generations of children and families. And I think in partnering, collaborating on how we strategies to support our families and our communities for healthy children in the future, partnerships are crucial. And Migenish Baksin Muanwet Nikan Chicken Munsoapan Gweno Gawasha Gaganin Megwach Gagashishwach. Tassikishagan Wabadan Emats Jeff the Bajum Nano Kimanganingash Nigansh Command Knagan. Me Nantikiagni no Chimat Knagan, no Daphne Mag, Hiwe the Bajmoon, Anin Gashmat Sejoash, Shagots. O ginachkade ban twichaga no ajko uniki kumagaye kwa mibgo mstahi antikiwen kwa kwani ni kwesta SLFNHA ganadan masin twichi koyag hiwe antikiwen gato tamagak shago
Mashke First Nations communities, resource people, nanadun mamin juichi goyak. Me gwetchen denendan, where gado the mag today, egwa chikago ident kimitiag, chikago wawichi, I gitago no goasha, kamat sewaj. Kwanino go kakine mat sewaj, kitiasha go to go ayawa, gweno ganadun the mwajuichi go swaj. Ni gwetch ticket. Ni gwetch.
Great, thank you everybody for being a witness to that. It's really important for us to celebrate these kind of accomplishments. Before you run away, we do have a gift.
Okay, next on the agenda is the audit presentation. Brian?
Good afternoon, everyone. So they put me right after lunch. I'm sorry to do finance right after lunch with you. I'll try and make this as painless as possible. I'm here to talk to you about the audit for the 24-25 fiscal year. Essentially, the financial statements are in your binders under tab 4. If you want to follow along. I guess the purpose is to just talk about the financial position of the organization and how we kind of performed over the last fiscal year. Our opinion was unqualified, which is good. That means that the financial statements that you see here, they've done all the testing and they present us fairly. And they're close to, as can be to the transactions as they happened. The first page I'm going to talk about is our statement of financial position. That's kind of a traditional balance sheet, and it's on page 1 of the financial statements. Just some key parts to talk about. Our total assets were very close to what they were the prior year, $81.2 million, and that's slightly down from 82.4. Just background assets are, money, land, buildings. It's the value of all our key the money that we have that's entrusted to us. The key drivers for the decrease was just a decrease in cash and cash equivalents, so we were down about $1.8 million, and also the money that was receivable from funding agencies was down a little bit as well. Amount due from funders decreased approximately $1.8 million. And there was an increase in the net book value in buildings. So we did, as I stated earlier in my other presentation, we had some buildings that were built on reserve for our health hubs, and some of the increase in our total assets was as a result of those buildings. Total liability, so that's, the money that we owe. It could be to the bank, to creditors. So our total liabilities decreased to 55.3, and that was down from 55.6 in 2024. So very close in terms of the liabilities. Slight increase in accounts payable and accruals. They were up by 3.2 million, and are offset by a decrease in deferred revenue, which was down by 3.9 million. Deferred revenue is a key figure, I guess, I want to bring to your attention. So that's money that ISC had, flowed to us to run programs, and we're now using some of that money that was, earmarked for years earlier. We're starting to use them. We used 3.9 million of it in the 24-25 year. Some of that is due to, we saw some decreases in new money from ISC, but we were able to sort of utilize some of the older money that they had given us to continue to run our programs. So deferred revenue in a little more detail. We have $13.9 million in deferred revenue. In year, we were able to reclassify, and this is with ISC's help. They were, very accommodating this way, from repayable to deferred, about 1.9 million. So that money was set to be returned to ISC, and we went through an exercise of reclassification, and it was, we were able to use it for programs last year and into the future. That was 1.9 million. We're working with ISC on work plans to spend this money on various health priorities, and we used $5.8 million of deferred revenue. As I said, new funding was greatly reduced. Net assets, so that's our assets minus liabilities, and that's sort of kind of what we're worth. The net assets stood at $26 million, and that was down slightly from $26.9 million in 2024. I'll turn your attention to the next statement. So that's the next page on page 2, and that's a statement of operation. And that was traditionally like an income statement. We see total revenues increased by about 4.6%. to $95.9 million, and that's up from $91.8 million in 2024. The main contributors to this change, as I stated earlier, there was $5.9 million in deferred revenue that we were able to use in year. The Ministry of Health funding was up from $17.5 million to $20.1 million. And as I said, ISC revenues dropped from $55.2 million in 2025, and it was $56.25 in 2024, so it's down slightly. Key total expenses to note are salary and benefits, so approximately 53% of total expenses, and $50.9 million for salary and benefits. We had more employees hired year over year, and fewer contractors. You'll see there's a professional service fee and contractors fee decreased to $6.5 million from $7.9, and that's because of the organization's ability to actually hire people and retain them. And that's better for our clients, I believe, if we have actual employees. It lends to better continuity of service and our ability to control a higher quality of service. Office equipment, materials, and supplies increased $805,000. Travel, training, and meetings saw increases of $1.8 million, and a lot of that's attributed to just travel costs. We have seen increased travel costs from our carriers, and we're also delivering more service in community, which has led to the increased costs. So I think that's a good news story there, that we're in community delivering service more often and having a bit of an increased cost there. Our interest in long-term debt was decreased by $160,000, so that's our loans from our major lender, which is CIBC, and that's because we worked with CIBC to get a better lending rate over the last year. They've been very, I think, cooperative with us to find the best vehicles to get the lowest rates. Our current lending rate for all our debt is in and around 3.34%, which, maybe if you want to earmark that for your communities as well in terms of your lending rates, that's a business rate, and that's a very good rate, and hopefully what your communities can also negotiate for yourselves as well. Excess of revenue over expenses, so that's, did we make money, did we lose money? This year we're in a deficit position, $850,997 compared to a surplus of last year of $4.3 million. The reasons, mainly the drivers, were higher operating costs despite the revenue growth. So areas like travel that we had discussed. But there's another funding shortfall from ISC in the area of oral health and the GADI program. So that's the General Anesthesia Dental Initiative. And that was post-COVID. The health authority took on the responsibility of coordinating dental services and dental surgery in partnership with Maniawan to deal with a real backlog of children that needed the service. We took some risk. We went in there. It was under Jordan's principle. We were funded for about a year fairly clearly on it. And then for the last 4 months, we had sort of run out of funding, but we do have supporting emails from the government saying we will continue to support this initiative until the end of the fiscal year. You will receive the funding. But it was never in a formal letter, and it has still not yet been approved. None of the funding has flown to the health authority, and we're forced to recognize the loss in our books of $1.5 million. The application is still sitting with Jordan's principal headquarters for approval. We're hopeful that it will get approved, but I do believe some of the First Nations are in the same position where you have risk-managed situations with Jordan's principle. You may have been given assurances that it will be paid, and you're now stuck either waiting for approval or have been denied. Statement of cash flows, which is the next statement on page 3. I'll just highlight some things here. Increased $3.3 million, up approximately $1 million from 2024. Key reasons, changes in working capital, particularly due from increases to accounts payable and reduction in amount due from funding agencies. Financing activities, no major new loans originating in this fiscal year. Repayment of our loans have decreased about $255,225 from $7.1 million in 2024. So we are repaying our loans. We haven't initiated any new loans in the last fiscal year, essentially. Tangible assets, total value increased to $25.6 million from $23.6 million in 2024. And that's due mainly to the investments in the health hubs. And again, significant investments in the organization's capacity to serve communities with the health hubs and vehicles in community. Overall financial stability, Liquidity, reasonable cash balance at $38.6 million as of March 31st, 2025. Our debt levels decreased, as I said, about that $255,000, and we're manageable with our current revenue streams. Liquidity, internal restricted funds of $2.412 million. So this amount that is put aside for the maintenance of the hostels in particular, just because there are 3 large facilities that we have to maintain. We've put money in reserve funds to be able to maintain them on an ongoing basis. And on a side note, in this fiscal year, we are projecting to spend some of that money on a new generator for JMK1. And that's projected to cost in and around $1 million. So we'll have, I think it's better service and safety for our clients at JMK1 by having the generator there, but it's going to cost a little bit. Key insights, revenue growth, relatively stable revenue with the use of deferred revenue from ISC as stated. Expense management, the year concluded with a net deficit of $851,000, a shift from the $4.2 million surplus in the prior years. So we're definitely, down in that respect. Inflationary pressures also we're seeing in areas like transport, salaries, and benefits, and that has caused the increase in expenses. Targeted investment, the deficit was driven by a $9.2 million increase in expenses, reflecting a significant investment in our workforce and service delivery infrastructure. Key takeaways, several areas of federal funding have not been renewed in the prior fiscal year, and even for this fiscal year, we have about $4.5 million of funding that has not yet been confirmed. Some of that in the areas of the escort program, which we talked about earlier, but we do have some verbal assurances that at least some of that money is coming to us. In other key areas like Jordan's Principle. Just like many of the communities, we had proposals in and we've received some partial funding, but there are some major gaps that we have not yet received funding for, and it continues to be a risk for us not to receive the money for this fiscal year. The 2024-2025 fiscal year was a challenging year due to the rising costs and non-renewal of key programs and funding. We were able to kind of mitigate that, as I said, with our deferred funding, and then we also saw the challenge of our $1.5 million from the GADI initiative that was not funded, and we had to take a loss for in this fiscal year. The outlook, continued financial health depends on prudent expense management, so we do have to keep an eye on our expenses for this year and for the coming fiscal years. We know that there's sort of austerity measures in with the federal government. We should all be aware that I believe there's a $5 billion projected cut to ISC in the next 3 fiscal years. That's going to affect our organization and I believe each of the communities in a different way. So it is going to require us to really, have a key eye on our financial resources, ensure that we're watching things on a timely basis, and like communicating well with our funders to know if spending cuts are coming or if they're not going to be approved. In our way forward, I did talk a little bit earlier about the new fiscal relationship grant that we're in. It gives us some stability for 10 years with our funding. It's similar to block funding with actually a little bit more flexibility and some with some growth factors, some key benefits in terms of us getting additional funding for inflation and the growth of our communities. So we are definitely happy to have as much of our funding in the NFR grant funding as possible. Are there any questions at this time?
That is your audit presentation. Is there any questions from the chiefs?
I have,
Archie. Chief
yeah,
Archie.
Chief Archie Wabath. I have a question on the assets due from funding agencies. No, where you have to pay back, where is that? Due to funding agencies on current liabilities, 14 million. Maybe you can clarify that. Like I don't understand why we have to pay back the funding agencies. What's the?
Yeah, and just going to go to the note as well, so I get a little more detail with it. So it's due to note 5, and it's how much money is due to each of the agencies. So
Actually, it's the, why do we need to pay back? It's on liabilities, current liabilities, maybe 1, 2, 3, 4, fourth line.
due to funding agencies. Okay, note 10. So that's money that we do, you know, in prior years, we have not been able to spend our allotment of funding. And some of the funding, you know, is not as flexible, and if you don't spend it in year, you have to return it. And unfortunately, that has happened to us a few times, and it was particularly in the periods of, I think it was 2019, 2020. With COVID, we got, you know, an influx of money, and then we had our regular program dollars, and they didn't get spent because we used the COVID funding. And a lot of that money, unfortunately, has to go back to the funding agencies, and they just haven't come to collect it yet. So we just have it on our books. So we have it in our bank account. It's there waiting to be collected, but the funding agencies will come and collect it or offset it against money that they owe us in the future.
Has there been negotiations in terms of redesigning the purpose of the funding, like maybe adjusting it or modifying it to a different new related program or something like that?
We did do that this year, especially with Indigenous Services Canada, and they were as flexible, I believe, as they could be with us. So they allowed us to reclassify about 1.9 million of that was repayable to deferred revenue that we were able to use kind of like in year or in the future years. But there's certain spending envelopes that have come to us that are so tight that they cannot be negotiated. Generally, the provincial monies like that, we did undergo an exercise the prior fiscal year with the province as well to try and reclassify as much as we could, and some of it was, but again, the province, you know, had certain parameters. They didn't allow us to do too much of it.
My last question on the income statement, where you have to pay $6.4 million professional fees and contractor services.
Yes.
Is that programming or just hiring people to do certain work tasks?
Yeah, it's, I'm going to say, a mixture of both, but the large majority of it is programming funding. And for some of it, we've gone out to request for a proposal, so make sure that we get the best value for our money. But the large majority of that, I don't have the breakdown in front of me, but the large majority of it is programs and services being delivered, and particularly actually right at the community level, we have contractors going in.
Is there any other questions? Chief Clifford Bowe.
I pressed the wrong button. I had a question regarding the auditor. It was signed off by M&P, and I'm not questioning the work of the auditor, but I just wanted to know if is there consideration for looking at other auditors, or are we remaining with this auditor? As certain requirements by legislation that you're supposed to change auditors once every few years, I think. Have you, and how many years have they been our auditors?
The total years that they've been our auditors, I don't know. It's been a long time. I'm going to say it's over between 10 to 15 years. We did run a request for proposal, not this year, but the year before. So to have a total open and transparent review. I believe M&P was the only auditor that applied at that point in time. And then before that, I'm going to say it was another 4 years before that, we had an RFP process, and they had won the RFP process. There was more auditors that had applied for it at that point in time. But there's no, I guess, requirement to change auditors, but it's good practice to at least ensure that you're getting best value for the money, and that they, we put out a request for a proposal. And we had planned to do that for like every 4 years. We go request for a proposal to ensure we get the best pricing and to get the best auditor for the job. Okay. Wesley.
I just wanted an explanation on statement of operations and changes, salaries and benefits, why there was such a significant increase of 7.23 million from the year prior.
Okay, and that's on the statement of operations we're talking about here? That's a good question. There's an increase of in and around $7 million year over year. A couple of different things. One is just an increase in our staffing. So we have hired more staff over that time. I think the year-over-year increase, we had retained or we had increased our staff to 30 additional staff from March 31st, 2024 to March 31st, 2025. Additionally, there are cost of living increases that have also been given to employees that is included in there. And it's just our regular benefits as well. So actually, the benefits under a different line. That's simply salary. So it's a key between employee wage increases and increase in employees, and then a reduction on the other end of using what do you call them? Professional services or contractors. So we've reduced on that end, we've increased on the employee end.
I just don't understand how it's such a big number when maybe I'm not thoroughly informed on how the wage, the hiring works, but that's for the CCUH. But for me as chief, it's just a huge number when, in my mind, we only opened Winnipeg, the Navigators, And then, I don't know, it just doesn't, the arithmetic's not working in my head. So, where did we increase? Like, where does the doctor's salaries come from?
Doctors' salaries are not in here, but other healthcare professionals would be. So allied health professionals, which are definitely hard to attract and retain, are paid out of this line, and yeah, their salaries would be there.
Huh. It would be nice if we had an idea of how much staff are in each sector. That way it gives us a good idea of, well, who does what and where.
Yeah, we can give a breakdown. That's something we could easily pull from, and we can send it out after the meeting. And as I said, 42% of our staff are First Nation staff from the communities that are working for us. And then there's also a lot of allied health professionals that are working for us as well. So we could get the breakdown of staff in each of the different classifications.
Okay. Well, yeah. Well, that's my question. I'd like to get a proper understanding of who does what, though, and who it's staffed by, and mostly for program reasons, because oftentimes we don't know who to go to. Things like that. That's why I'm asking too. So.
Okay. I think Sonia's got a comment as well.
Yeah, so it's an important question, and I think really the difference between last year and this year's report is that we also increased programs and services in Thunder Bay. So that increased our numbers in terms of the salaries for all of the drivers and the navigators in Thunder Bay, the vehicle administration, like all of those things. So I mean, if you look at the number of staff positions, we actually increased last year. It accounts for about $5 million of that $7 million, plus the allied professional positions that we've taken now from contract services and put in as employees. So you'll see there's a shift in the budget in terms of the contracts that we would have been paying for into salaries and benefits, because now they're employees with the organization. It's all for you.
Any other questions? Since there's no more, I thank Brian for submitting the audit report to you. We are now going to go into the acceptance resolutions. If I can have the resolution on the screen, please. The first one will be the audit report that you have just received. Who is putting the things? Okay. They're not on there. Oh, it's between the two of you. Okay. The resolution 25XX. Have we gone to a numbering? Acceptance of fiscal year 24-25 audit report to the Sulakaut First Nations Health Authority. Whereas Sulakaut First Nations Health Authority is mandated to provide a report to Sulakaut area chiefs on the financial activities of the organization, whereas the financial report is in the form of an audit completed for the activities of the organization for the fiscal year 24-25, and whereas the audit report for SLFNHA has been prepared for the Sulakaut area chiefs to review, therefore be it resolved that the Chiefs Assembly accept a report to the Sulakaut First Nations Health Authority 24-25, dated on this day, the 10th of September 2025 in Laxville First Nation. I require a mover. I require a mover. Do I have to offer a prize? Chief Donnie Morris moves it. Do I have a seconder? Chief Lorraine Crane, thank you very much. You've had questions presented. You had questions on this report already, so I'm going to go into the decision. Any opposition? Do we have any abstentions? I see none on both counts, so therefore we have consensus as carried. The next resolution on the selection of 2526 auditor for SLFNHA. Yeah, there. Whereas the Sioux First Nations Health Authority bylaw number 1 requires that the Chiefs and Assembly annually appoint an auditor to audit the accounts of the Sioux First Nations Health Authority. Therefore, be it resolved that MNPLLP XYZ are appointed as SLFNHA's auditor for the 25-26 fiscal year. Today's date, September 25th, Lac Seul. Do I have a mover? Chief Clifford Bowl, Lac Seul First Nation. Do I have a seconder? Do Jennifer, what's her name? Let me check your name. Jennifer Fiddler, proxy, Bearskin Lake First Nation, seconds it. Is there opposition to this resolution? Is there abstentions? I see none on both counts, so therefore we have consensus that's carried. Acceptance of 25th annual report. Whereas Sioux First Nations Health Authority is mandated to provide a report to the Sioux First Nations area chiefs on the activities of the organization, whereas 25th annual report of the Sioux First Nations Health Authority Board Chair, President, and CEO and SLFNHA programs have been presented to the Chiefs and Assembly. Therefore, be it resolved that the Chiefs and Assembly accept the Sioux First Nations Health Authority 25th annual report. Today's date here in Lac Seul. We've had those presentations and we've had a lot of questions and comments on this. Do I have a mover? Do I have Chief Wesley, Russell Wesley, Cat Lake? Do I have a seconder? Chief Archie Wabas, thank you very much. Ready for the question? All those opposed? All those abstaining? I see none on both counts. We have consensus. Go ahead.
So the next item on our agenda is business items, SLFNHA 2022 and 2027 strategic plan evaluation. Who's presenting? It's on tab 5.
Bonjour, good afternoon. Manitou Wasamon Dishnikaz, Megaze Tutem, Megaze Sage Gandonji. My name is Jennifer DeRoger, and I currently serve as the Senior Director, Strategic Policy, Planning and Quality here at SLFNHA. We're here today to share some information about the strategic plan evaluation, the engagement pathway, and mental health and addictions. So I have my colleagues here, Bobby Christink and Ashley Pressinger, and we'll present the information as a team. Miigwech. Okay, so on the screen is the current strategic plan for SLFNHA for 2022 to 2027. This was also shared earlier by our President and CEO, Sonia Isaac-Mann. And these are our strategic directions that have been developed and approved by the SLFNHA Board of Directors. Again, community ownership, service experience, and health transformation. And we also lean on our vision, mission, and values of the organization. So the current strategic plan was developed by the SLFNHA Board of Directors in consultation with our Chiefs Council on Health, Tribal Council representatives, and also elders, and it was approved by the board in 2022. So the work plan report for this past fiscal year, we looked at it in quarters. So for the first quarter, as a team, we worked to establish a SLFNHA-wide work plan. So we were all working towards achieving the goals within the SLFNHA strategic plan, and we focused on planning and structure. In the second quarter, we did a lot of internal engagement, working with senior managers and department leads to implement the work plans and to integrate the department goals and objectives. In the third quarter, there was a lot of activity that was already being completed. We had 188 goals completed during that time. There were integrated service delivery plans and also improvements to governance approaches. And to end off quarter four, we had over 380 goals completed, and there was an emphasis on cultural integration and regional collaboration as well. We did share some of this information earlier this year. I believe it was in July, but we did share some of the rates of the different initiatives and goals that were completed throughout the year. So it started off small in quarter one, where we had 31 or 35 initiatives completed. And by the end of the fourth quarter, we had over 380 initiatives and goals completed. So this demonstrates a significant surge in achievement and a strong close to the fiscal year. But we also have work to do. And there were a number of different activities that are either in progress or incomplete at this time. So we have 178 in quarter one, and in quarter four, we have over 600 initiatives and goals that are in progress or near completion. So that reflects a full momentum in focused execution in the different strategic areas. So for the strategic direction of community ownership, one of the key achievements was the development of a First Nations Health Director Network concept. So it is developed. Bobby here will share a little bit about that concept later. But it's about creating a platform for community input, regional collaboration, information sharing, training opportunities, and peer support amongst the health directors from the SLFNHA communities. We do have 53 goals around communication strategy and some of the internal and external initiatives involved in that. The community engagement process, there are 7 broader goals where we are working towards enhancing community participation, increasing awareness, and developing a regional engagement pathway. Again, Bobby will speak to this when she talks about engagement and partnerships. And then community relationships. So we've been working steadily to strengthen relationships with communities and our partners, involving engagement strategies and regional leadership dialogue. For the health transformation strategic direction, we did launch the Chakotay virtual traditional teachings and the Jitawan cultural awareness program. We do have a newer program at SLFNHA, the Anishinaabe Watazuin team. Our director is sitting in the back, Anna Marie Kakagamic. She's working very hard to ensure that the cultural values, beliefs, and ways of knowing are integrated in what we do at SLFNHA. We thank her and her team for their contributions. Healthcare professionals from in and from the communities, there's 25 different goals. So this would be largely led by our people and culture team and our HR staff, working to ensure that our hiring First Nation practices are implemented and sharing information and opportunities with communities is available and shared. We also have provided technical support to our Chiefs Council on Health and their 5-point strategy. We do have that information available, and we've shared it and had multiple meetings around the strategy. The strategic direction around service experience. So there's been some work around the EMR, so the electronic medical record systems, where we're sharing information now with ISC, the nurses and community providers, to improve shared care planning and coordination of referrals and services. We also have chart auditing software. It's called Sphere. So it's been also deployed across the EMRs, which also enhances privacy and accountability. There are several goals around client experience and service improvement. We do have satisfaction surveys. We're implementing an incident reporting system, organizational wide, and that continues to be developed. We're also working on a patient advocacy bundle for communities and for service providers. It's currently in development, and it also includes a compliments and complaints process. We also have integrated service delivery goals. Again, the EMR fully integrated and is enabled by multiple health teams. So the strategic management framework, so this was introduced when Sonia arrived on scene a couple of years ago, and it includes a lot of different parts. So there's a lot of different moving parts here, so we're currently building it out to make sure that the parts move together in tandem, but there's also a lot of work to do in terms of developing some of the information. For example, the strategic evaluation, which is what we're doing, and it's being launched today, as Sonia mentioned it earlier. So there is a peach-colored survey in your package, and we are looking to you to provide some of that community information about how well you think SLFNHA is doing in terms of implementing the strategic plan. So we'll continue to map out the work that's required for the management framework and implement it at organizational level. This slide was shared earlier also by Sonia, talking about where we came from, where we are now, and where we're going. We are prepping to gather information for the next strategic cycle, and we really look forward to hearing feedback and input from communities as to what you feel our priority should be moving forward. So we did some pre-planning for the evaluation as a team. The process starts again today in the fall 2025. We have mapped it out to be an 18-month process. There's several groups that we'll be meeting with and having some discussions with including yourselves as chiefs, the tribal councils, health directors, our Chiefs Council on Health, our board of directors, our senior managers, and broader staff. So we're looking for a wide array of information and feedback, where we'll then move to the analysis part of that and try to determine what people are seeing as the next set of strategic priorities for the organization. And then, of course, it would go to the board for their final input, approval, and endorsement. And then we'll be bringing it back to the Chiefs table to share that information. And the next strategic planning cycle is 2027 to 2032. So we are looking forward a couple of years and making sure that we're on track and we're working towards meeting the community needs. We also want to make sure that we're identifying what we're doing well and what are some of the areas where we can improve. We want to stay focused on our goals, make sure that we're using our resources wisely. We want to be open and accountable and sharing how decisions are being made. And most importantly, we want to reflect the priorities of the community. So your feedback during this evaluation process is very valuable to us, and we're going to work hard to make sure that the next strategic priorities are meeting the needs and truly reflective of what the communities are seeking from us. And the evaluation process includes a couple of things. We define objectives and standards. We're going to collect some data and analyze it, identify what we've completed in our current plan and what's incomplete, some of which might have to roll over into the next cycle, which is fine. We will establish criteria, identify some of the gaps and issues, challenges and barriers. We'll be engaging internally with the staff, with the board, with the CCOH, but we'll also be engaging externally with our tribal councils, partners, and communities, and just really looking forward to this next process, and we're open to feedback. So if you have any information or things that you really want to share that's important to you, just reach out to us and we'll be sure to include it into our analysis. So I'm going to hand it over to Bobby now, who will talk a little bit about the engagement and partnerships plan. Miigwech.
Perfect. Thank you, Jennifer. Good afternoon, everybody. Just want to say thank you to all the chiefs. Thank you to Chief Bull again for hosting us on our next meeting we had from July. Thank you to all the health directors who attended, the partners, guests, everybody for your time. My name is Bobby Christink. I am the Director of Engagement and Partnerships. I am a member of Lac-Seul First Nation. I have been with SLFNHA just over 7 years. So I'm here to share an update on the work our team has been co-developing with many people here and health directors and all along in our engagement meetings. So today I'm going to be talking about some of the recent engagement meetings, the proposed community engagement pathway that includes a community-led cycle for input and response on health priorities, as well as strategic planning. Our work to build a health directors network, and a few team updates and a new initiative we have launched. Oh, there we go. Okay. So the slide here is just highlighting some of our engagement meeting summary. So to date, President and CEO Sonia has held 4 quarterly regional engagement approach meetings and with tribal council executives, and our engagement team has held 5 tribal council meetings. We've also met with all 3 independent First Nations. We will continue to visit communities regularly to ensure voices are heard on an ongoing basis. Through these meetings, communities have clearly expressed the need for early and consistent engagement, transparency in decision-making, and better coordination across health services. This is why we are co-developing a community engagement pathway, a first step to strengthen relationships and ensure health priorities are shaped by community direction. The engagement meetings have highlighted some reoccurring themes. As you can see, some of the top ones are mental health, long-term care, diabetes, dialysis, reciprocal engagement, NIHB, transportation, medical appointments, health, human resources and workforce, service coordination, funding transparency, and EMR and technology. Oh, I gotta go back one, thank you. Perfect. So this is a little bit of summary on our health directors engagement. So we've also been directly engaging with many health directors, with 21, but I believe it's actually probably more than that we've held so far. These conversations have given us the opportunity to validate and gather input and hear more about what health directors are seeing directly in their communities. As part of those discussions, we asked what they would like to see in the development of a health directors network, regional health directors network that would make it meaningful, useful, and truly health director led. So I'll be discussing more in the health directors network on the upcoming slides. So in addition to those sessions, community visits began in March 2025. We've been regularly trying to hit a lot of the community days this summer and really getting our team up there. We've had many invitations, and those invitations now grow and grow, which is very exciting. During this phase, we've been asking a series of questions. So we're calling it gathering community voices. And part of that first phase of questions were, what are the health priorities that you're seeing in your communities? Are there any community meeting protocols that we should be aware of before we're coming in? What does good engagement look like in your community? And what are some examples of some strong community programs that you see? And also, what does a health directors network, and what should it include, and what would you like to get out of it? So this feedback has really directly shaped the direction we're moving in with the health directors network, and we're really grateful to everybody who's shared their insights with us so far. So this leads us to the proposed community engagement pathway. So we've been co-developing this through conversations in our engagement meetings with tribal councils, health directors, and communities, and really reflects what we've heard so far. So the goal is to create a community-led cycle of engagement with input gathered at each key gathering so that decision-making stays connected to community direction. We're aiming to have a shared, supported version by this fall 2025. We have laid out this draft pathway, the phases, the feedback loop, with the goal of launching. But where does this actually lead to? What does regional engagement actually look like? How do health priorities move through this pathway in a way that ensures community-led input and response? So that'll bring us to our next slide. The proposed engagement in circle. So now that you've seen the overall building of the community engagement pathway, I want to show you how that pathway continues into an ongoing cycle of input and community-led response. So this engagement circle is a proposed way for community health priorities to move through key discussions to allow for ongoing reflection, input, and response, and to make space for community voices to guide the work at many levels. So it includes where we are right now, so the annual general meeting, and then what we just had in July was the special chiefs and elders meetings, the regional engagement approach, quarterly tribal council executive level discussions, the health directors network meetings and ongoing cycle of engagement through that, and First Nations health staff input gathered through annual sessions and training. So as you can see, the circle is really built out and ensure that the health priorities are coming into the circle, they're being raised regularly at these meetings all throughout the year, reviewed together with communities, and that decisions are coming out shaped by community direction. The idea is to create this ongoing feedback loop where health priorities come in, shaped through dialogue, and the response is a community-led decision. Okay, so more on the Health Directors Network. So currently we have several key engagement spaces. Like I mentioned previously, we have the AGM, we have the Special Chiefs and Elders meeting, and quarterly regional engagement approach with Tribal Council at an executive level. So as part of this engagement circle, we're missing the one piece, and we want to build out that Health Directors Network. So this is a space for community and tribal council health directors to come together, learn from one another, share what they're hearing, and help move priorities forward. The initial engagement conversations we had with the community and tribal council health directors would now be funneled into a health directors network that we've begun building. This network can include monthly questions, check-ins, biannual in-person gatherings, and really just to keep the flow of the engagement consistent and grounded in health priorities. During our gathering community voices sessions and through in-person health director discussions, we've been asking, what would you like to see in the Health Directors Network? And here's what we've heard so far. So a sharing wisdom circle, learning opportunities, wellness resources, a shared calendar of meetings and events. The purpose of this network would be to support health directors in their roles, provide space to gather for input on health priorities, support community-led feedback, and strengthen coordination and advocacy across the region. This network would be the final piece that connects the engagement pathway circle, bringing together what we've heard and built so far. The Health Directors Network is on track to launch this fall, probably end of October, as part of the engagement circle, one that supports consistent community voice and decision making. So I just wanted to give you a little bit of update on our engagement and partnerships team. So we've been in business now for just over a year. It's been very exciting to be a part of this and building the team. And so the engagement and partnerships team, we're focused on building strong relationships by listening to community voices and making space for those voices to guide our work. Over the past year, we've grown. So we now have 5 engagement and partnership team members, and we've taken on also some new areas to help us better connect with communities and getting our messages out there. So event coordination is now part of our teams, very exciting. We'll be supporting events across SLFNHA and ensure they reflect both community values and organizational goals. We're also now support our lovely communications team who's here today, helping us better align messaging with our engagement work, both internal and with partners, tribal councils, and communities. Unified communication strategy is fully in draft and ready to go shortly, and we'll be sharing it with communities for feedback soon. We also have the new 2025 Programs and Services Guide. A copy should have been in your bags, I believe. So this year's version of the Programs and Services, we had more detailed department information, pages for tribal council and partners and independent First Nations. We also had more partner program details, QR codes to support referrals. And for 2026, we're going to start working on shortly. We're also planning to have it translated as well. We also launched a very exciting new platform too, the SLFNHA Radio Show, hosted on Wawate Radio. So it's called SLFNHA Radio Connect, and that is also translated. So the goal is to inform and connect with First Nation members across the region. There'll be 12 episodes this year. I believe 7 have aired so far. Each show features different departments, updates, and discussions tied to SLFNHA's strategic goals. So you can find the show on our website, on Wawate, and on our YouTube channel. And of course, we have a booth out front here, so we would love to connect with you and connect us with your communities. All right, so for next steps, we're going to be working on community engagement visits, ramping those up for this fall as well, gathering input and validation direct from communities. Like I said, the development and launch of the Health Directors Network, continuing the SLFNHA Radio Show, updates from departments and partners, and our new 2026 Programs and Services Guide, and a translated version. Share and finalize the communication strategy, and launch the community engagement pathway and circle for fall 2025. Miigwech for your time today and for all the insights that you've all shared over the last year. The pathway, the priorities, and our engagement approach only work if they're built together with community voices leading the way. We're committed to make sure the work reflects the community direction and that it moves in a good way at a good pace. We're excited to keep working with you, and we look forward to keep building with you. Miigwech, thank you. I'll pass it over to Ashley at this point.
Hi, everyone. My name is Ashley Pressinger. I am the project manager for mental health and addictions at SLFNHA. And I just want to share some of the work that we've been doing since I started. So one of the things that we're really focusing on is looking at past resolutions to determine directions that we've received in mental health and addictions but maybe haven't achieved. So we have 21 resolutions that have been passed since 2007 that have to do with mental health and addictions. So part of this review is looking at what we've been directed to do, what's been completed, what is in the works, and what needs to be started. So there's a document with that once it's done we'll be happy to share, but this is some of the work that we've started. So it is essentially an audit just to see what is happening and what isn't happening based on resolutions. So a lot of this project work is stemming from 3 reports. I'm sure I hope everyone's had a chance to see them. I have highlighted these reports in a past presentation, but the first 2 reports hold a number of recommendations, and those recommendations are another area that we're looking at determining and auditing. What recommendations have we implemented, what ones still need to be implemented, and what ones maybe don't necessarily apply anymore. So we're working from these 3 reports to determine next steps of the project. So this project stems from a resolution that was passed in 2023, which declared a public health emergency and social crisis, particularly to address mental health and addictions. So it was passed, and there were several sort of key directives that we received. One was to develop a media and advocacy strategy, which we are currently in the process of doing. ACW already has a number of media strategies in place, so we will be working with them to further that. Another direction was to form a joint mental health and addiction task force. That has also been developed. We are hosting an in-person mental health and addiction task force meeting in November. It's an opportunity to sort of set out future goals, what are the priorities, where do we need to go as a task force, and how does SLFNHA support that task force. We sought funding, and we hosted a mental health and addiction forum last November, which actually was quite successful. We gained a lot of information from that, and hopefully moving forward, if the funding allows, we would like to do something like that again. And we've also been directed to move ahead with a mental health and addiction strategy that doesn't interfere with community services or with tribal councils. So working with communities and tribal councils to ensure that the work that SLFNHA is doing in mental health and addictions doesn't contradict or get in the way. There were 2 points that called on the federal government, and this is where Sonia and Jennifer are working to sort of advocate, as well as with Nan, around adequate funding for mental health and addiction support in communities, as well as accessing services, and also to adhere to treaty obligations. So those were 2 other directions from the resolution. So just from the forum that was hosted in November, we gained a lot of information about what communities deem priorities, what are some of the mental health and addiction concerns, and really looking at sort of what's our foundation and how do we move forward. So this is just one of the images that was designed during it. We do have a report from that, which I'm happy to share with anybody if you're interested, but we do have a report from that forum. So as I mentioned, we have a task force. It's probably hard to read this, but this is the task force members and who they represent, their position in the organization that they represent. So as I said, we're going to be getting together in November to have an in-person task force meeting. It's going to be over the course of 2 days. So the first day is just the task force members, and then the second day is inviting regional service providers to develop sort of a model or an impact, community impact model, so that we're all moving forward in mental health and addictions together and not sort of separately. So what does the task force do? The membership provides ongoing oversight of the project. So it helps with guiding SLFNHA's work in mental health and addictions, with determining what priorities are, how best to allocate funds and resources. There was a terms of reference developed. We have had a few meetings, but we're really looking in November to really start to direct and determine where the task force wants to go and how this project is going to sort of form based on that feedback. So this is the model that was developed in one of the reports. This was done in consultation with community members and participants at several different engagements. This is the model that this project and mental health and addictions is working from. So if you look in the yellow areas, those are priority areas. So it was identified that prevention and promotion is a priority area for achieving mental health wellness. So all those yellow areas are a priority, and the task force did identify youth and treatment as sort of the first priorities to start with, which is some of the work that I've been doing. So we have a project charter. It outlines the mandate of this project, the goals of the project, activities that we've already completed, and proposed outcomes. So again, we want to sort of bring this back to the task force, make sure that this is sort of the direction that they're happy with this, direction. And we're funded to the end of 2026, and then we have to sort of determine what the project's going to look like after that. But this is the charter that we've been working from. So thank you for letting me take up your time and talk about this. I'm always open to questions. Jennifer's also a great resource for questions. So if you have any questions or concerns or ideas, I'd love to hear them. So thank you.
Chief Russell Wesley.
That's excellent work. Covered a great many details. But there's been changes that have happened. A lot of changes happened with that guy south of the border, where we have to approach things differently. Yeah, I think most of all the biggest problem we have is the government's position on funding as a whole. And just recently, and I'm sure other chiefs have run into this same problem, is that government that says that they have no funding. And our colleague over there, Adan, will tell you that that they're told by government that there's no funding. In fact, they're cutting back on funding in a whole wide range of sectors, and that's a problem. And I'd go as far as to say that that position comes from the senior ministers and all that. And it's right across the board, like whether you're dealing with IAC, which is an environmental assessment part of the federal government, whether you're dealing with them or whether you're dealing with child care or whatever, the position is the same. There's no funding. We're not going to look at increasing the funding or whatever. So even though we've done all of this really great work, we've prepped ourselves to be in a position where we can deal with these problems we have in the community effectively. But then you're faced with the scenario I just described with the government, so that presents a really big problem. So just recently I submitted operations and program funding proposal to ISC, and that was the response I got. So this is why I was saying earlier that that we need to shift our focus from program-based solutions to, and I say this too because our Deputy Grand Chief, Ajahn Ibanez, was in the room, is that this needs to be taken up at the NAN level, not just at the SLFNHA level, because it's such a huge issue. And in the particular case of the operations and program proposal that I submitted, it was $7 million or something like that. I don't remember the exact number, but what I said to them when they responded to that was, well, I'm just going to go to your band office because that's where the decisions are made. Up in Ottawa there, I was there a few months ago, admiring all those nice big paintings on the wall and the marble floors, and I says, wow, that's a nice band office. Meanwhile, I'm about to fall through the floor in my band office. I don't think we've ever had a band office. But anyway, I'm just saying, you know, and I think we're going to have to deal with this at the cabinet level. And we're going to have to package all of our issues, and this is for Anna Betty over there, because this falls at the man chief's level, is that we're going to have to package all of our problems and approach cabinet directly. Because we're not going to get anywhere with our colleagues like Adan over there, because he's only working on the program agenda, and I don't think we're going to get anywhere dealing with program agendas, whether it's health, education, or whatever, because they've stated very clearly they don't have funding, and they don't have the mandate to pursue other additional funding. I'm sure that's true, right? Yeah. That's what government says. So the only way we can address this issue is through the treaty relationship and deal directly with cabinet. This is why I was saying earlier that I think we need to shift our focus from a program-based agenda to one of needs-based transfer agreement basis. That means you're going through a government-to-government relationship. To me, I think we have enough materials in order to quickly put together a position outlining what those costs are in the various sectors, including health. And right now, I'm looking to open my cultural recovery center, as we're calling it, next month. Most of my staffing is in place. All my programming is in place. All the factors to making cultural. I just don't have funding. that's up to them folks up at ISK and FINIBS. But I think that's the only option I have is for me to go to cabinet. And the way to do that is through the Privy Council Secretary. And then that's probably what I'm going to do with that particular issue that I'm dealing with. And I'm just raising this because this applies in pretty much all sectors with this particular government. And I just wanted to let it be known to my colleagues, the other chiefs, that my deputy chief had, put together a list of all of our needs in the community, whether it was mental health, addictions, health needs, health transformation, education transformation, all of those things that we need in the community. It's totals of something like $350 million or something like that. I'd put out the list if I had it in front of me, but I don't have it. But that's how much funding I need at this point, about $350 million. That includes all season road infrastructure, air transportation, medical, the health transformation piece that we're trying to convince everybody we need to do, all of that. I got a message yesterday from government. We'll give it to you. So I'm a bit of a conundrum right now, because it comes with a price under the critical mineral strategy. So what they're telling me is, if you give up this, we'll give it to you. You think that's fair? But I'm just highlighting these, that what a typical community has to deal with. But anyways, I just wanted to share all those, to, kind of, and not to make it a shocking reality, but that's what it is. That's what we have to deal with. And this is what I'm recommending, is that we put that forth and get our NAN leadership level to approach that on a cabinet scale. That's what I'm saying. Because what I'm finding when we're dealing with these is, in the last assembly I talked about our own organizations being barriers. But that's because we're dealing with it on a program basis, and we're all fighting for what's already there. And that's the reality we also live in too. And I don't like that. I don't like fighting Matthew for his share of the dollars. That's not fair. But that's what we work with. But the only way we can influence change is if we're able to change the funders' policies. And I was mentioning to Sonia over there about working in conditions environment nurses have to be in. That's because it's policy. The only way you can make change is if you change those policies, and the only way you can do that is if you have a government-to-government relationship. And that is the biggest barrier we have to deal with. And I tell you, we need to change that policy. And I've been saying that time and time again. If you can't change policy, you're not going to change the program funding. So I just wanted to leave that bad taste in everybody's mouth, because that's exactly what it is. And my colleagues here, they understand what I'm talking about. But I think what we need is a wherewithal to force that change. I suggest we start with holding him hostage. Sorry, then. All right, Michelle, amigos.
Miigwech for your comments, Chief Wesley. We always appreciate your insights and your perspectives. In terms of government funding and things that we may be expecting in the coming months, I just wanted to pass it to Sonia to see if she wants to make any additional comments. Miigwech.
Yeah, I completely agree with everything you've said, Chief Wesley. And I'm happy that Nan is actually in the room listening to this, because I think we all have a role to play in this in terms of being able to move this forward. I mean, I look at what we have in terms of budgets for the programs and services that we need to deliver as an organization to address the needs of the communities, and it's not enough. And it is restricted by policy. And policies are in place because governments put them there. So I don't see why we can't be those really strong, loud voices to push for policy change. If those policies aren't working to meet the needs of our communities, then communities and leadership have the right to push against them. So I think, we need to figure out what our strategy is going to be on that. And I did speak to Deputy Grand Chief earlier this morning about working together in partnership with NAN from a technical perspective, like the operations side in terms of delivery of service, and then the political arm of the work that NAN is going to do. I'm happy to sit at that table and support that work moving forward. The other piece I think that, and I sent you a text, some information that people probably may or may not know, but the funding that we get from the government isn't the funding that they actually have in trust for First Nations people. There's just like trillions of dollars sitting in trust, and $35 billion a year is interest money. We don't see any of that as First Nations people, so why isn't that being dealt with? Does everybody know what that is? The trust that's been put in ISK? And I'm not talking about ISK Health, I'm talking about ISK, like Indigenous Northern Affairs. No? Okay, we'll pull some information together on that for you, because that's an important piece of the conversation moving forward, and it is a big political one that NAN needs to be pushing, Chiefs of Ontario needs to be pushing, the Assembly of First Nations needs to be pushing. Communities sign treaties with the intention that there would be resource sharing. There would be funding that would be coming to communities to deliver service for health, education, housing, economic development, and the list goes on. Have any of those been upheld? I don't think so. So, I mean, I'm kind of stepping into political territory here, but that's stuff that we need to have a conversation on, and how we're going to do that and what role SLFNHA can play to support that work. Because we do have information and we do have some data that can help push that conversation forward. So I'm happy to commit to doing that kind of work with the communities. And I think the Chiefs Council on Health does have a role to play in that in terms of that 5-point strategy. And part of it is looking at what's the legal component to this that we need to take in order to address these issues that you're always raising with us year after year, that aren't being addressed appropriately by government partners, both provincial and federal. So I'm happy to support that. And we'll get more information on that so we can share it with the chiefs in terms of what a strategy could look like moving forward. Oh, just in terms of the budget issues, obviously communities aren't adequately resourced either to do this work, and Brian mentioned this already, but the government, and thankfully it is a Liberal government. If it would have been a Conservative government, we would have been in deeper waters than we are now. So a 15% or budget cut, or $15 billion over 3 years, is actually, is it no, it's million. Billion, $5 billion this year, 10 the next, and then 15. If a Conservative government had come in, I was projecting a 40 to 50% cut right out of the gate. So $5 billion year one isn't as bad as it could have been, although it's not great. So part of what I've been following is the Minister of Health has been, and the senior ADM for Indigenous Services has indicated they're going to try and protect ISK funding to the best of their ability, but they might not be successful in that. So that's going to mean impacts for organizations like SLFNHA, community funding. Jordan's Principal's already seeing those cuts. I think we need to think about how we're going to approach that, because they're talking about cutting programs and services for First Nations people that are already the most vulnerable, have the biggest disparities and the biggest health gaps. We're not going to be able to catch up if we're being consistently cut for the next 3 years. So that's something we're going to need to take into consideration as we move this work forward. And I'm happy to have that conversation with our political partners as well. So.
Chief Archie Webas.
Thank you. Thank you for your presentation. I really like the presentation. It seems to be covering so many places and so many points of where our needs are. I would like to Chief Russell mentions about all of the work that we do. All of the work that we do is good. And then can we turn that work, those plans, into money is the question. The question is determine how much in dollar amounts will it take to make our health to work is the question. So in the current state, if you tally up our funding that we get from ISC, roughly 50 million to 80 million to SLFNHA. They're the First Nations, an average of 2 million, that's 60 million to 80 million. Tribal councils and independents, maybe roughly 15, 20 million. You're probably looking around 125 to 150 million every year that we get from the government. And still, it's not enough, right? And it's not enough. So, Chief Russell's question is a good question. If we're getting 125 to 160 million every year, so where's the lack? Where's the lack? Are these financial resources being properly utilized to help First Nations people, rights holders? Maybe we can look at that, get a real number for the last 10 years, maybe for the last 5 years. How much have we been receiving? And then going forward, we should have a budget. We should have a budget based on what we've received, and these are the amounts that we have received, and that doesn't really reflect to the reality of these costs in remote First Nations or things like that. And the numbers can change, numbers can be increased in our budget, and that would be our negotiating leverage moving forward. That's what we're talking about, is the numbers of dollars. Even if we make plans like this one here, plans, how turn that into money, dollars. Like, how much are we talking about here? Yeah, going forward. Right now, we're probably sitting at 125 million to 150 million. Okay, and going forward, we still need maybe 50 million, I don't know. That's a good question, okay? Miigwech, I thought I was going to present that, thank you.
Miigwech, Chief, that's a great question. I am not a money person, so I will respectfully hand it over to either Sonia or Brian to speak to some of the financial projections that we make at SLFNHA and the actuals, so I'll hand it over. Miigwech.
Yeah, I appreciate those comments, Chief Wabas, and I think, you know, we've started to take a look at some of those projections and what's going to be needed to actually address the needs from a program service delivery perspective. So we did have a contract last year with a health economist to take a look at what we would need just for SLFNHA. This doesn't include tribal councils, it doesn't include communities, but we could look at, you know, extrapolating what that could look like based on those numbers to include tribal councils and community costing. So we can take that away and see what we can do with that. And it's a big number, by the way. It was like significant. I'll make a comment on that.
Yeah, particularly even if you count in the gap that, you know, the support that we get for our services compared to what ISC gets in terms of support for their services. You know, we're talking like the legal and administrative support around their whole administration. They don't give near that to any of the First Nations or the First Nation organizations. ISC does things like they pay themselves a northern allowance. They don't allow for that for any of the organizations that or communities that they're paying for. And just to give you a bit of an insight in terms of how much that is, that's $23,000 per employee per year for that northern allowance. If they have a family, if they don't have a family, it's around $13,000 a year. Plus the benefits and the gap there in terms of what they're giving First Nations and organizations to pay for their employees. It's a huge gap, and we've done like some preliminary analysis in terms of what that gap is, and we'll be happy to kind of like work that out with you and share it for sure.
Chief Green?
It's pretty hard to, for me, it's hard to sit back and without expressing what I think as I'm listening. I guess I was looking at the model there, and thank you for using that thought. We need to figure out where we came from, where we've been, and where we're going. And I think until then that we'll never get out of this cycle, because this is not our way. I've been saying that for a long time, and I know I probably sound like I repeat myself, and I get criticized for that because I do that. Some people don't like to hear something being repeated, but it has to be said. You know, I'm really glad for the work that you ladies have done. Thank you. And that picture, yes, our land is the first and foremost, our land and water, and then our traditions, our way of life, and our language. Those are three. Kaya hindi ko ka tashim ito saan ay pigak ito saan dyan shunabem wan English indoors, I still have the language. I think that's something that's so important, and I don't mean to put anybody down that doesn't have the language. We're still together. Well, it doesn't matter where we came from or which community. I believe our people are are together, and we're going to be strong if we stay together. So that's what I was looking at on your model there. I don't know if you just put those things in any order, but for me, that's what I was thinking about looking at the model. We need to get back to our land and waters, first and foremost. Then we need to hang on to our traditions and all the ways of life that was taught to us. A lot of us still have them. The old teachings, the way we used to fix everything. Nothing ever went to waste when I was home on the land with my kokum. Nothing. She wouldn't even let us to cut a tree down without, she would always say, use a dead wood. That's what she taught us, and I don't know where the elders got that, but that's the way they taught us. The other thing that I would suggest here for your November conference, look for people that have made it. Young people, especially young people. There is young people that have passed it. They're able to walk through. And there's older people that have lived it and able to walk through. We need to hear those stories, and the communities need to hear those stories. I get so discouraged when I'm at home, and I'm not going to start naming names on my hands who I'm talking about. You know how sad it is to see people wandering around day in, day out? It's very sad. And I feel so helpless sometimes because I can't help them. Yes, I can tell them. I did it this way. I did it that way. But I just wanted to share that because it really touches me when we talk about mental health and addictions, because we've all lost somebody. I've lost people, young people, to midlife. And I come from a small community, but we've lost young people. I just want to be, I want to help in this in any way I can with SLFNHA. If I can be included. I don't have any answers, immediate answers, but I do see what is happening. And I've been saying this for quite a while now. When are we going to get alarmed? How many more people are we going to lose? That's one thing I want to say to this group here, to the chiefs and also to SLFNHA. It's very alarming what's happening. And I think it started in my mind, probably in the 80s, mid-80s, when you started seeing different things coming in. But you always saw, I grew up with, many of us grew up with alcohol in our homes. or around us. So now we don't know what's there. We don't know what people are mixing and what it's doing to them. What is it doing to their health? What is it doing to their organs, their own bodies? That's what I think about when I think about addictions. Because addictions could be many, many things. But mainly right now I'm talking about drugs. Because I don't know what's coming in our communities. So the organizers, if you can think about finding people that are willing to tell their stories, because I think that's what we need to hear that, because the younger people need to hear the truth. They need to know where somebody has been, so they're going to want to not walk in that path. I think I better stop as I get too, I might just start crying, or I don't know what I'm gonna do. Because
So I don't see any other comments. We're going to go into a 15-minute break. Sorry. Chief Moreau.
Okay, thank you. I won't be long. I just wanted to echo Chief Wesley's comments earlier. Obviously, that's something that we need to explore as chiefs and as leaders and as political entities here, not only in this setting, other settings as well, NAN, COO, AFN. And I just wanted to kind of echo the example that he gave about us as a First Nation. We got 33 communities under SLFNHA right now. I think it's at 33. And each community approach, or each community provided those numbers of the dollar figures of what they would need to basically support their First Nation. I mean, the example of Chief West's community, 300 million, and I know Michigan will be about the same, if not more, because we're a bigger community. And this is what when I mentioned, and I spoke earlier about how do we collectively send that message to the funders, to those policy that are obviously policies that are programmed. And again, when you talk about program, again, go back to the word program itself is specifically that we're so programmed to abide by all these policies right from whenever the treaty was signed. So, and I just want to put that out there because us as a First Nation, obviously we're advocating, we're trying to obviously better our community as well, as much as we can with our health services, with our education and mental health services, what have you. And interestingly, last week I was speaking with one of the ISC officials on one of the projects that they're pursuing. And as lightly as she could speak about what we're talking about, she kind of mentioned Bill 5. And that to me right there, and again, going back to the example Chief West said, provided about at what cost do I pursue the project that I need to pursue because it's a need for a community, but they kind of dangle Bill 5, almost saying, without saying, you know, we'll approve your project if you consider Bill 5. And that's the honest truth. That's what it seems to be going. It seems to be shifting that way with a lot of our ISC officials and the funders and who, what have you. And that's kind of scary when you think about it. And I bring that up and I say that because it was said to me last week with talking to an ISC official about one of our projects, a much needed project for our community. And of course I shut that down. So now moving forward, I'm also going to meet with the provincial
minister regarding some of these projects, and I'm pretty sure he's going to mention that as well. So I just wanted to kind of echo what Chief Wesley said, and everybody else, I think, is basically saying here that, you know, these are the times. This is what's going on. They're using our land against us. We always knew that. So they're taking bold steps of making basically an ultimatum, almost, it seems, without saying it. So I just wanted to include that. Thank you.
My apologies again, Chief Merle. I don't see anybody else, so we're going to take a 15-minute break.
Thank you. Just a question to the delegation. We have one more subject item, or you can go for a 15-minute break and then come and do it. How would you like to proceed? Gotta go for a 15-minute break? Nobody's jumping on my offer? So let's continue. Thank you very much. Thank you very much for the presentation. The last item on the agenda for today is on the Chiefs Forum. Okay, this is the time that when they have health-related issues that the chiefs would like to put on the table, this is the time to do it. The floor is open. The floor is open for the Chiefs Forum.
I don't know if we're taking a break or continuing.
I don't know if you heard me when I said we're going to have a 15-minute break, so I was just letting him. They're going for a 15-minute break.
What?
They're going for a 15-minute break.
You're going for a 15-minute break? Okay, go for a 15-minute break. Back at 5 after 4. Oh, by the way, if you're going out at the registration for your chiefs and delegates travel, thanks.
will be for the next 4 years. That guy over there is not going to be, where did he go? That guy over there is not going to be, where did he go? If he's not going to be funding our projects at the local reserves, our organization, I don't know what the weight will look like now. And I kind of like what Russell and Merle chiefs were talking about. What's the total cost to our projects? Maybe if we combine all of our total costs and approach the Treasury and try and force them to acknowledge government they submit their budgets, total budgets for the year. I think that'd be a good process to start looking at within this liberal term.
Yeah. Thank you, Chief. The floor is open on the Chiefs Forum. Chief Archie Wabas.
Miigwech, Chairman. The work that's been done on our regional health plans, and what Donnie mentioned, the projects, the initiatives, community initiatives, cultural-based programs. You get George's principle, choose life. In terms of submitting our proposal, is it going to be collective, or is it going to be tribal, council-based, or is it going to be a First Nation, individual First Nation submitting their own proposals? I mean, what's the recommendation? Like health transformation, as part of that process, we have to complete that evaluation and planning, and also identifying costs. ANAPI, when would that be available, or what are the next steps? Like, I don't know if somebody can answer this, the question. All right, thank you.
Thank you, Chief Wabas. Sonia?
So yes and no. I think, we've done a lot of work in this area around health transformation and looking at the First Nations authority and control over health. The costing of that is something that I think is outstanding. And I won't speak for Nan. I know you're in the room and you're planning on talking about this tomorrow. But there was some resolutions from Nan last year about looking at the costs that communities have, and that's across all of Nan, not just SLFNHA communities, but in terms of the agreements that are in place, I don't know where that's gone. So maybe tomorrow, Deputy Grand Chief, if you could potentially touch on that, that would be great. I think we're going to need to do a deeper dive analysis for this region because the context is quite different. And the whole system cost, I think, is something that we need to talk about. It's not just the programs and services that SLFNHA delivers or the programs and services that communities receive funding for. It's much bigger than that. So it includes the tribal councils, it includes the physician services, it includes the hospital in Sioux Lookout that is there to service the communities of this region. and their funding, and I would argue that their levels of funding are also not adequate to meet the needs, so I think it's a bigger system review. And then we can look at, and I like the concept of looking at a Treasury Board submission, and there's nothing in the guidelines for Treasury Board submission that says that communities or a conglomerate of communities can't submit a budget through that process. So, I mean, if the communities want to do that, that can be done.
Thank you. Chief Russell Wesley.
Miigwech, I just wanted to talk about two things affecting Cat Lake at this point as part of this Chiefs Forum. The first one is I want to capitalize while Dan is sitting here, is the, as you all know, our nursing station burnt down, and we were able to I should really thank the Creator for how everything turned out. How that nursing station burned down in March, and we were able to, our technical guys at Wendigo were able to source and modulars and get them set up literally 3 months after the nursing station burnt down. So I was extremely thankful for that. But while that was happening, well before that, I think it was in the 2023 Ontario Joint Gathering in Toronto, I had presented a design for a new health center. So after the nursing station burnt down, I asked if we could just further that submission at the 2023 Joint Ontario Gathering. And nope, we had to start from scratch. So we've just completed the first phase, and we're going to design now. And I would like to ask ISC to see if we can expedite that and have a response in time for the fall Joint Ontario Gathering coming up. And I say this again, time and time again, that certain approvals need to follow the Winter Road window. And that Winter Road is usually the month of July. So you know, then maybe you need to liaise with your colleagues to see how we can realize the scheduling for the design phase so that it coincides with certain time frames. Thank you very much. The second issue I have is the mental health. I lost my train of thought. The mental health and addictions piece is an ongoing issue, and for the last couple of assemblies, including the Nan Chiefs Assembly, I wasn't able to attend the Kiwewin Assembly for personal reasons, and but I want to reiterate again to my colleagues, technicians, and government that we need to approach mental health and addictions as in the area of government relations, not on a program basis. We need to set up, as I was saying earlier, some kind of trilateral table that discusses all the program issues that we're currently working with, such as these wonderful reports that we've been presented with. These are happening right across Ontario region, whether it's WAHA or whether it's SLFNHA. These reports are being generated, whether it's cancer, mental health and addictions, and they're all programs based. But what we need is the policy wherewithal of government to make changes. And one of the things that I've been saying is that to government is we need to take into account the Ministry of Mental Health and Addictions, the Federal Ministry of Mental Health and Addictions, and come up with a sound strategy, because mental opioid and chemical addictions are past the crisis point. And I don't know how else I can say this to convince everybody and anyone. It's getting to the point where, I want to do something, civil disobedience or something, just to prove a point. I don't care anymore. I don't care if I go to jail. But something has to happen. And the problem is in the policy. If you can change policy, you have the ability to manipulate funding or create new funding to address that particular policy issue. That's where the problem is. And I'm big in government. Please, come to the table. We're ready. I think the last time a major initiative was addressed in terms of addictions was the solvent abuse crisis back in the 80s, where a program called Aboriginal Healing and Wellness Strategy was in effect. That's the last time. Since then, nothing has happened except Band-Aids, like the RAM program. What the hell's a RAM program in Thunder Bay going to do for me, for my people? What's 7 additional beds at the Minoyayan Hospital going to do for our communities? There's 2,200 people in the remote north. We need a standalone strategy. And that's my concern, because it impacts us all, every single one of us. I challenge anyone to say I haven't lost any family member due to addiction or a mental health issue. So when are we going to collectively get up and raise this issue? Where's our leadership? And that's my concern. It is an ongoing concern. I have many more, but I want to leave room for my colleagues to address theirs. Thank you.
Thank you very much, Chief. Chief Clifford Bull.
Miigwech, Chiefs. Tomorrow, we're going to hear a presentation. This is sort of a preliminary offering that I'm doing this morning as to what you'll be hearing. I'm not going to talk about the presentation so much, but when we talk about the scourge of drugs in our communities, the mental health issues, the suicides, it's rampant everywhere. We all know that. So in Lac Seul, we've been working on a drug and alcohol strategy for many years, as other communities have as well, I would assume. And we're going to take the bull by the horns. And we're going to build a facility, a wellness facility on Lac Seul. And that's what you're going to be hearing tomorrow, a presentation on how communities to the north and SLFNHA partners can sign an agreement, much like what we saw this afternoon with Tikanagan, where we collectively work together to address those issues. Healing, people that want to be healed. The problem I also have is with people trying to send people out. And there's a backlog of 500 people. In the meantime, the person is still struggling in the community. And I know my co-chair, Chief Donnie Morris, he became proactive in their community and said, we're going to put money to the side. I think they've already spent in total of $7 million from internal sources, their own money, to send people out. And that's what we're going to do. To me, that's a prime example of how people can help their people. So we put 1.5 million, which is not very much. But when you think about treatment centers nowadays, we did some research. They can run anywhere from 10,000 to 250,000 for one person. So this is right across Canada. So we're going to start sending people out. We've already sent one person. And then we're working with our local police, our prevention programs, our administrators. We may, obviously the money is going to run out, but then we're going to put more money and more money and more money. That's fine, as long as you save a life. To me, life is more important, and healing is more important. So those are some of the things that we're working on, and we'll hear more about this wellness facility. It's going to be on a point over there on the north end, Kichi Bay, in a beautiful location, and we all hear that saying, the land is the healer, and that's true. It'll be right on the land. People can bring their families. And I just came back from Muskrat Dam and looked at their facility, and Chief Donnie Morris was there and other chiefs. We went and did a tour, and then in the evening we went fishing. And guess what I caught? I caught a clam. I got a picture to prove it. But I had a couple of bites. But anyways, these are some of the things that we're trying to do, and trying to save our people. And I think if we all work together collectively, cohesively, and I think we can start saving our children, our youth, and families that need the help they need. And working with, as well, our NAN partners. Miigwech.
Thank you, Chief. The floor is open for Chief's Forum. Yes, Jennifer Fiddler.
Jennifer Fiddler, proxy for First Connect First Nation. I would like our health director to be recognized to speak.
Hello? I'm not a chief. I don't know how to operate it. I don't know if what I'm going to say has been mentioned. I'm trying to work with these hearing aids I have, and it just seems to pick up everything. I'm sitting back there, I can hear Brian talking to somebody over there, as if he was sitting beside me. Anyway, and the other thing is I have 3 name tags, so I'm not sure which name I'm using today. My question was, has to do with Minnehaha Hospital. I'm not sure if I heard anything about from, say, I'll call it complaints department. I know back home I get reports trickling in about the treatment of patients in the hospital. There's rumors of verbal abuse by the staff, lack of service. Also, I know that at one point there, a few months back, I had a daughter in there who wasn't in a regular bed, but some kind of room with another lady, an older lady from, I think, one of them. And that old lady's escort wasn't around very much, and she doesn't speak English. So it's a good thing my daughter was beside her because she got her to get the staff and interpret for her. So all these things, I don't know if any other communities have any reports of what I'm talking about here. I think that's pretty well what I wanted to ask.
Thank you. Wesley. Any other comments on the Chiefs Forum? Yes, Matthew.
What you proxy for? I'm proxy for what? Because I guess most of you are aware of the things that are happening at Wapikika as well as Kingfisher. There's one thing that I've been really thinking about in terms of the crises that are happening in our communities. A lot of times we struggle to get the help that the communities require. And I'm very appreciative of all the support that we get from the agencies such as SLFNHA and also NODN, NAN, and the other agencies. But it's not enough. It's not enough. A lot of times what we do is we just put out the fire. That's good to go. Atsina esakinamank iwekaje mastejoya. And a lot of times there's no follow-up. How are we gonna be able to continue to support those families that are affected through the trauma? And I think that's something that we, meaning SLFNHA chiefs and also the health directors and the other agencies, that we need to come together to try to find ways of how we can do a better job of supporting any crisis that happen. A lot of times we can't really do anything a lot of times because we just don't have those people that the mental health workers and even the trauma team, we don't have sufficient of resource that we need in order to effectively support the communities that are in need. I just wanted to mention that maybe there's a way through this forum, even at NAN, to try to find a better system that can be created and implemented when it's needed. Right now, we just go with the flow. A lot of times we just don't have enough resource that's required. Even the crisis teams, nobody wants to help out. I just wanted to kind of bring that out. I think that's something that we all of us experience. Just wanted to bring that out. Thank you, amigos.
Thank you, Matthew. Any other submissions on the Chiefs Forum? Yes, I'll go to Alan Tate first and then go to Chief Wabas after.
Miigwech. I don't know how to say this, but anyways, I'm a proxy for Saskatchewan Lake First Nation, and I want to declare a conflict of interest with my position as a health director at Wendigo First Nations Council as well. And the reason to that is I wanted to ask for materials for my community. We just had an election in April, and we're talking about resolutions on mental health. I want to provide the materials to the new chief and council. So that's one. And Saskatchewan Lake has had serious mental health issues. I'll bring up one. A couple of years ago, there was a Saskatchewan Lake band member that committed suicide, and after the assessment, it was found that there were a suicide pact. And since then, four have succeeded, and during that time, there were organizations from the Shnabowski Nation, SLFNHA, mental health, SLFNHA's mental health, as well as Wendigo, and our MPP, Saul Mamaka, was there as well on a couple of meetings. And there was a big strategic plan that was developed, and previous chief Simon Tate waited and waited for the plan that was developed, but it never materialized. So what previous chief did was, what he had said was, he had assisted in trying to get clients to get into treatment centers, but he was unsuccessful because of the waiting list in Ontario. So what he did was he went to a private treatment center, which the band had to pay, and it was a 90-day program. 90-day program at the cost of $45,500. And I think he had well over 30 individuals that went, and the band paid. And at one point in time, Indigenous Service Canada was using the program dollars to pay for the cost of the transportation, as well as the fees, in order to, what he had found out was that it was helping them. It was helping the clients that went there. And when they came back, what he called was aftercare. And he tried asking Indigenous Service Canada for an aftercare program facility, and he was turned down. So what he did was he made a road from our main community to Little Saskatchewan, which is about 25 or 30 kilometers from the community, and And what his plan was to build some kind of a big building there so where aftercare can be used as aftercare. But he didn't make it back in April, so he had good plans. And just last week, you know, there's stories about individuals that are using drugs, meth or whatever you call it. But anyways, there's these individuals that are walking around. What Chief Simon T used to say was that there's individuals walking around talking and talking to somebody, but there's actually talking to themselves. And just last week, there was this a young person, a young mother, who got injured. He was on his four-wheeler and he was driving around. He was driving around intoxicated and he crashed. She crashed and she almost, if she had landed on the road, she would have died. But the thing that saved her life was that she fell into a ditch where there was grass. And mental health. And just last night there was an incident. Last night in my community that there was an assault against a young man who suffered a broken arm, broken leg, and cheekbone, and an operation on his eye. And then we do have a lot of mental health issues that need to be dealt with. Although we have counselors that go in, that's when do mental health department and goes in there, but we still need more resources. And I don't know how SLFNHA can help in our community. We lack in infrastructure. We don't have no extra buildings to accommodate the resources that is required. And the other thing I'll mention is that when a person is reaching out for help, our counselors or the counselors that go into our community, they're hesitant in going to a home because of safety reasons. I think that's it. I think that's what all I want to say. Thank you very much.
Thank you, Alan. Chief Archie Wabas.
Miigwech, Chairman Wally. Thank you. And then on these immediate needs, our health needs, for our people. They're waiting. They're waiting for us. They're waiting for some solutions. They're waiting for improvements. Ani nagaonje ak anja manusik wichud ekidot nuichigun kaman sisnun ego on kadum. I don't know if I want to come back here again to repeat myself. I don't think we should. On these immediate needs and the crisis that we're in, I think we have the power and the ability to declare that we have a Chiefs Committee on Health, along with the Chiefs, to tell Prime Minister and ISC and Health Minister, we want to meet with you on this specific date and time and place. And if you guys don't show up, you're going to be breaching your judiciary responsibility and duty to honor the crown. Okay? So time is, it's enough playing around, because we've signed a treaty 1929, 1930, along with 1904, 1905 version. We signed a treaty with the Crown, and the Crown responsibility was given to Canada to administer the Crown's wishes. So we still have the treaty arrangement on health with the Crown. So it's up to us to say, let's have a meeting. Let's have a meeting with them now. And if they don't come, they will breach their judiciary responsibility and duty to honor the Crown. So if that's the case, we're going to have to do a litigation or file a complaint. File a complaint in Canadian Human Rights Tribal Council. Tribunal. There is so much discrimination already to our people. We're being discriminated through a system, systematically discriminated. I think that's enough. I don't want to come back here again and say the same thing as a chief, because my people are suffering. I think we should take that, notify Prime Minister and the ministers responsible for our health program. All right, thank you.
Thank you very much, Chief Wabas. Floor is open for the delegates. I see no one, so I want to thank the Chiefs for the contribution you have made into the Chiefs Forum. The issues that are very important to each of you. I will be going into closing very shortly. I just want to share a thought with you as you finish your Chiefs Forum. And that is, we have seen a lot of good work being done by Sulakaut First Nations Health Authority, moving in a direction where there's going to be a lot more community process-driven things done. And, but while we have this relationship that is from Canada and Ontario, that is sort of subservient, no amount of good work on reserve is going to make a difference. And I think it's time that the chiefs and communities begin to exercise their prerogatives and be aggressive in proacting in terms of exercising your jurisdiction. There's one thing we have never given up in the treaty process, and that is the right to control, the right to decide. And that is our self-determination. That's about what sovereignty is. So I'd just like to encourage you that you move in that direction, to consider in all the things in order to make an impact at the community. It's time that we tell Canada and Ontario, this is what you're doing, this is what we are doing. You know, whether it complies with their legislation or not is not the issue. Let them come and tell us. And, you know, and not just to have some civil servants write a letter, say, this is against the policy. And I think people addressing those things, that we need to change the policy because, you know, under the, what I call the Crown colonial pathway, the relationship, it has failed for the last 100 years. And we cannot afford to continue in that context. So with that, I'd like to thank each one of you for your contribution today. And we're going into, did you have any comments?
I guess my closing comments are in regards to mental health. You know, mental health takes many forms, and one of the things that I have experienced in terms of mental health, and it's a personal experience, and I'm going to say this because it does link to health. When you have a loss that breaks your heart, whether it's a friend or a niece or a nephew, I had a loss that was a brother, and was a baby brother. And that grief took a toll on my body. I hurt, my joints hurt, my body hurt, and my heart hurt. And then I was feeling that I was like having a heart attack, you know, and then this amount of grief was taking over my body. And then I had to go to the clinic to make sure that I was okay. And I think about that kind of loss, and then loss after loss. It just really has a toll on our people. And so those are things that we have to really look at, is the grief of how it affects mental health. And I just wanted to say that because I think a lot of us carry that grief, and that we have to really look at it, and just to make sure that we are well mentally, especially when we talk about these challenges that we continue to have day in, day out, you know. So those are just my thoughts, and I just wanted to share that because I try to analyze myself in terms of how I react to situations, and how my peers react. So those are just things that I want to say, and I'm thankful to be asked to co-chair this, and I want to say that years before, when a discussion of health, we used to have packed rooms, and I think we need to restore those packed rooms with our young people and our elders, and we need to start bringing them out, because you know we talk about succession plans. Who's going to replace me? You know, those are things that we're going to have to think about. And how are we going to do those succession plans if we don't bring our young people? We have a high school down the road. They could be coming to listen to some of these issues, like, you know, just even knowing that they might not understand it, but something might trigger them and take health, become a doctor. I don't know. Anyhow, thank you for listening to my rant.
Thank you very much, Brenda. With that, we're going to go into a closing prayer, and we have Violet choose the elder to do the closing. Does she have a microphone there? No, she doesn't have a microphone. And then after the prayer, we'll have the drummers do the closing song.
me gotchen the nanda me get quite a guang and in Chikakitan. Nash go education gay non Chikakitan. Aye, Inga, Daya. Namanan that's a go, oh, Moko, Mokoanoka. Son of a king up me to watch, Okamakan. Where does Meshki go, Mark? I Slate Falls. I think there's Catholic. Me ganak my aunt and an aganak. She can't make a guess get in and my op mako. I guess into my cook. I shall go skank can down. Is second get this conic and the meon. And this na Senator na wash mats upon manga no kid noden. And give papi short or yak. Kamach short, kaman and the margin. We send the one a chicken one a pasiquiak, and another ten mego, a guanyok, get an American yok count chiek. Made the discussion not one in a ma. I got the name Magayan. A guanyok and e boyot, or Marcana. Santa Cosiot. When I go, Panache, Jano Nash, not a can't the mechanic. Me and the man long, can she Santa Cosiot? Shall go to Canning, get the mud sinking, the lago wash against got Supona. Cashinia, got the Shintasing, got the Nashtaki, such get the Shintaman. Gemat sinna. Picking of get antistic, gemat sinna. Me shit to Shanta Costigan care, as me got gentleman. Only me got. Mayor?
Thank you very much. We convene again tomorrow morning at 9 o'clock. Thank you.